Good morning, everyone. For the speakers who would like to try the microphone, you can basically activate them.
Hello, hello.
Hello, good morning.
Good morning. Sounds all good?
It sounds all good. So this is for Natasha Muscat, I suspect.
Good morning, this is Anna Carla.
Good morning, Anna Carla.
So you can hear me? Yes, yeah, thank you.
Very clearly.
Good morning, this is Anne Peuterman.
Good morning, Anne. And it works well as well. Thank you.
Okay, thank you.
Good morning.
Good morning.
Good morning, I'm Zdzislawa Ostrczylová.
Good morning.
Good morning, dobry den.
Dobrý den.
Well, ladies and gentlemen, I think that we can maybe start before officially opening our conference. Let me to welcome you from here, Secretariat of Age Platform Europe in Brussels. My name is Maciej Kucharczyk and I am Secretary General of Age Platform Europe. Before going to the program of the conference, let me just to share with you some housekeeping rules and information. So first of all, that's important. We have today the interpretation between English, French and Czech. Therefore, please choose connect to the language of your choice. We have for the moment 240 registered participants. I presume that they will be connecting with us along the whole day. On top of this, as well, our conference is web streamed, which means that we will not be able to see all the participants in the list of here on the screen, because there will be also those who will follow us through a YouTube channel. Of course, there is usually you are already we are all used to use Zoom links. So of course, there is a chat that you can use during the conference. It is available for comments, for questions. But at the same time, I would like to clarify that in the panels 1, 2, and 3, we will have, in any case, on top of the possibility to ask questions in the chat, there will be also some space for direct questions and answers between our speakers and participants. I would also like, in case you will be taking the floor, to ask the questions, but also for the speakers, please use, if possible, the headset with a dedicated microphone. This will grandly ease the work of interpreters. So I would say this is all in terms of housekeeping rules. I think all is now set perfectly, therefore we can launch the conference. So again, a very warm welcome, good morning, bonjour, dobry den. On behalf of Age Platform, I would like to welcome all of you at this annual conference of Age Platform Europe 2022, which, by the way, takes place under the official patronage of the Czech Presidency of the Council of the European Union. This year, when we're preparing this conference, we thought what should be the focus, the most, let's say, relevant topic that we would like to discuss with all different speakers, our partners and allies. And we thought that the best choice would be to address one of the most important developments in the social field at the European level, which is namely the EU Care Strategy, which was launched earlier this year in September by the European Commission. Why this strategy is that important for age, but also for speaking very broadly on behalf of our constituencies, but also older people, it is because this strategy sets out for the first time a European approach to long-term care. This is something that we welcome extremely warmly. The proposal, by the way, also follows the engagement made by President Ursula von der Leyen in her speech of the Union last year. And this strategy is, of course, an outcome of the consultation carried out by the European Commission on the Green Paper on Aging. As Age Platform Europe, we stand, and for the years we've been advocating for a new vision on long-term care. Long-term care, which we understand as a system of provision of services which empower everyone throughout our lives. And building, of course, on this vision, we would like to see now the EU Care strategy to be implemented, first of all, based on the rights of everyone in need of care, the right to autonomy, to independence, to participation, basically to continue being equal within our societies. Of course, when we talk about service provision of long-term care for age, it is equally important to address the issue of adequate investment in long-term care, about the extension of access, improved quality and working, of course, conditions, both in formal long-term care settings, care services, but also the support for informal carers. Therefore, looking at our today's program, we are very pleased to have gathered around this virtual table some key stakeholders that we have invited to this discussion on the future of long-term care. So we would like to listen to their insights, speakers who represent, by the way, both policymakers, service providers, but also national, international experts, as well as advocates and older people themselves. So we would like, they all very kindly accepted our invitation, and today we would like to listen to their thoughts, ideas, recommendations on how to implement such an empowering model of long-term care. Therefore, let me to thank you again once more to all of you for your interest in Age conference and, of course, for your precious time to be with us today. Now I will turn directly to this. I have the pleasure to host this opening session of our conference. And we will start. I have a pleasure to pass the floor to our two distinguished speakers representing two institutions. First of all, the Czech Presidency of the Council to the European Union, and then the European Commission. Ms. Zdzislawa Ostrčilova, Czech Deputy Minister for Social Services and Family Policy. Serdeczne przywitanie na naszej konferencji. Let me thank you once again for this patronage that your government has given to our conference. Your presidency is obviously concerned by this EU Care strategy very directly. You are carrying on the discussions on the Commission's proposal for the Council recommendations on long-term care. Therefore, we will be most interested to know from the perspective of the Czech Republic, but also on behalf of the EU presidency, how you plan to implement the EU Care strategy. So, dear Deputy Minister, the floor is yours.
Tak ještě jednou dobrý den, vážené dámy, vážení pánové. Já jenom obraz se mi nedaří spustit, tak nevím, jestli ho spouštíte vy, nebo ho mám spustit já. Ale můžu mluvit takto inkognito.
Don't worry, the most important is that indeed we hear you very well, so if we cannot have the vision, it's still fine. Please go ahead.
Dobře, tak ještě jednou. Vážené dámy, vážení pánové, ráda bych poděkovala panu generálnímu tajemníkovi Kucharčkovi a celé Age Platform Europe za uspořádání této akce a za pozvání. Je to pro nás a pro mě velkou ctí zde promluvit a i promluvit za celé české předsednictví. Česká republika na počátku roku 2018 měla více než 2 miliony obyvatel ve věku 65 a více let, což je víc než 19% celkového počtu obyvatelstva. Při naplnění všech předpokladů, které byly vydefinovány v roce 2018, se bude počet obyvatel ve věku 65 let každoročně zvyšovat, a to až do roku 2058 včetně. Seniori jsou často vnímáni jako konzervativnější než mladí jedinci a jsou chápáni jako nositelé tradičních hodnot. Odpovědnost dětí vůči rodičům a rodičů vůči dětem je často ovlivněna prostředím, vzděláním, rodinným stavem a religiozitou jedince na úrovni jeho mezigenerační solidarity. Těší mě, že v České republice došlo v období 2018 až 2022 k významným posunům v oblasti problematiky stárnutí. A ještě než se dostanu k hlavnímu tématu svého příspěvku, kterým je Evropská strategie péče, ráda bych se o některé z nich s vámi podělila. Podařilo se nám realizovat projekt financovaný z evropských zdrojů, implementace politiky stárnutí na krajskou, tedy regionální úroveň. A tím se nám podařilo také toto téma politiky stárnutí etablovat na regionální úrovni a více ji rozšířit do širokých vrstev společnosti, ale také na municipální úroveň. Vznikla také Komise pro spravedlivé důchody v roce 2019. Došlo k nárůstu starobních důchodů a úpravě valorizačních pravidel důchodů. Také jsme organizovali několikrát mezinárodní konferenci ke Dni seniorů 1.10. v letech 2017 až 2019. Vznikla také pracovní skupina na ochranu práv starších osob při Radě vlády pro lidská práva v roce 2020. A v letošním roce vznikla pracovní skupina pro seniory a stárnutí populace pod Radou vlády pro seniory a stárnutí populace, která je zaměřena právě na řešení aktuálních témat. Strategický rámec přípravy na stárnutí společnosti na období 2021 až 2025 byl schválen vládou v loňském září. A na to navazuje akční plán, který stanoví, tento teď definujeme, který stanoví konkrétní indikátory plnění. Bude se zaměřovat především na tato témata. Posílení a rozvoj forem mezigeneračního dialogu a komunikace. Posilování osobní zodpovědnosti, aktivního a zdravého stárnutí. Posilování rodiny jako celku. Větší informovanosti společnosti o tématu týrání seniorů a zároveň vytváření inovativních programů prevence vůči různým formám násilí. Rozvoj kvalitních služeb. Posilování bezpečnosti služeb v kolektivních zařízeních jako systémového prvku, nikoliv jen formálně. Opakovaně bezpečnost ověřovat. Narušování stereotypních prezentací seniorů v médiích. Podporu seniorů v oblasti nakládání s informacemi při orientaci a rozpoznávání toho, co je důležité, rozvoj odolnosti seniorů vůči dezinformacím. Toto je nyní u nás velké téma. Systematické osvojování IT dovedností a moderních technologií u seniorů. Česká republika uvítala publikaci sdělení o Evropské strategii péče i souvisejícího návrhu doporučení Rady. Česká republika obecně vítá navrženou iniciativu, neboť vnímá problematickou situaci pečujících osob. České předsednictví vnímá důležitost oblasti dlouhodobé péče v rámci zajištění důstojného života starších osob, osob se zdravotním postižením a osob vyžadující péči druhé osoby z jiných důvodů. Podporu oblasti dlouhodobé péče, respektive zasazení o provedení systémových změn směřující k integraci, provázání sociálních a zdravotních služeb, je zakotvena rovněž v programovém prohlášení současné vlády v České republice. Pandemie onemocnění COVID-19 zvýraznila některé dlouhodobé výzvy v oblasti dlouhodobé péče, jako je nedostatek pracovníků, nedostatečná podpora neformálních pečujících, nedostatečná kontinuita a návaznost některých služeb dlouhodobé péče a obecně připravenost na zátěžové a krizové situace. České předsednictví mimo jiné i na toto téma uspořádalo tematickou diskuzi v rámci zasedání Výboru pro sociální ochranu v Praze v září tohoto roku. Pandemie také poukázala mimo jiné i na důležitost podpory kvality života a sociálního začleňování osob s potřebou dlouhodobé péče a neformálních pečovatelů a potřebu větší flexibility a schopnosti poskytovat služby dlouhodobé péče v domácím a komunitním prostředí. Základním předpokladem pro úspěšné ukotvení a rozvoj dlouhodobé péče je velmi intenzivní a úzká spolupráce všech aktérů, kteří se na zajišťování dlouhodobé péče podílí. Vítáme výzvy členským státům týkající se zvyšování nabídky služeb dlouhodobé péče a zajištění vyvážené kombinace služeb ve všech prostředích, ve kterých je péče poskytovaná. Podporujeme také východisko, že lidé mají mít možnost volby. Jaké služby budou využívat, v jakém prostředí a v jaké formě. Česká republika také dlouhodobě podporuje zavádění technologií do oblasti dlouhodobé péče a také podporujeme sociální dialog v odvětví péče jak na úrovni podnikové, tak na úrovni odvětvové. Vážené dámy, vážení pánové, jsme v zásadním tématu. Řešíme zásadní téma a ještě jednou děkuji za tento prostor pro diskuzi nad ním. Děkuji a přeji úspěšné jednání.
Deputy Minister, thank you very much for giving this in a nutshell, for sharing with us how you at the national level with your government you approach the question of reforming long-term care, but also, as you said, looking into the cooperation with other member states at the European level together, knowing, of course, that the competence in this field lies in the hands of member states, but that indeed there is space for discussing and actually getting inspiration in between different member states, different models and approaches, which can put in place this model, as I said in the introduction, based on the right of everyone to autonomy, independence. So basically a system which empowers all of us. What you said also echoes a number of issues that we as Age Platform Europe, we put in the discussion on long-term care, the focus that we wish to make. For example, you mentioned the question of choice, the choice in the provision, in accessing long-term care, regarding the place, the form of care. This is absolutely, I would say, a milestone, absolutely necessary in the provision of care for older people. You also mentioned, and I thank you very much for bringing us back to the context of the COVID-19. We all know how dramatic the situation was in respect to long-term care. We believe that the debate on how to build on those lessons, this process is not yet finished. I think national governments, European institutions, service providers, we all together need to build on the lessons from this pandemic to ensure that in the future we will not have a similar situation, as you said, with the shortages and all the lackings in the continuum of care provided for older people, and again with infringement to the rights to dignity of older people. So thank you very much for bringing this context of the COVID into this discussion. Thank you very much once again, and I will now have the pleasure to move to the second key speaker in this opening session, Ms. Ana Carla Pereira. You were a member of the cabinet, you were expert in the cabinet of Commissioner Nicolas Schmit, responsible for jobs and social rights. Well, I think it's obvious why we have invited you today to this conference. Your DG is the mother, right, to say so, of the EU Care strategy. Over the past years, you had very intense works to prepare this strategy. Now we know what we are talking about. We thank you, your commissioner and your services, for bringing this important document in the follow-up, as we said, to the Green Paper on Aging. So now, of course, we would be most interested to listen how you think with the proposal that you tabled, how together with the member states you will implement this ambitious project for long-term care. By the way, you can also share with us exactly initially what was behind, what kind of ambition you put behind this proposal, but of course looking forward how we can make sure that will be implemented in line with all which was proposed in this strategy. So again, thank you very much for being with us, and the floor is yours.
Yes, thank you very much, Masai. I hope you hear me well.
Perfect.
And thank you very much to Age Platform for inviting me to this event. I'm really happy to join you, even if virtually, for this conversation. Let me start by mentioning what you have just said, Masai, that of course the European Care Strategy is the result of a work that has been going on for some time already, for some years. And this work has certainly been characterized by intense consultations to the different stakeholders. And I want to thank the contributions of the Age Platform to this discussion, to this preparatory work. I think you have in many instances inspired our reflections. I will not present the strategy because by this time I believe most of you have read it. If not, then I'll invite you to have a look at it. But I would like to mention 3 reasons why we have put this initiative forward, and then discuss a little bit the issue of implementation. For us, if I have to pick 3 issues why we have brought this initiative forward and why politically this is important, I would mention, first of all, the issue of inclusion. This is an initiative about social inclusion, social protection, and social investment. When we look at the figures, and the minister had already mentioned the amount of people that might be in need of care services, and we are talking here primarily about the elderly, these numbers call on us to have a political approach and a public approach to the issue. Now, when we look at what is currently happening and not only what will be the needs of the future, we already know that 1/3 of the households who currently would need support in long-term care services don't have access to home care services. We already know that we have 13% of parents who don't put their children or don't have access to childcare facilities because they cannot afford it. And here, of course, I would like to make a small comment that, of course, the care strategy brings a lifelong life cycle approach, and is not merely about focusing on the elderly or people with disabilities. It's really about a full range of services, starting from those that are just born. So when we look at the deficits that exist today in terms of provision of care services, this calls on a reinforced social investment. This calls on new looks to ensure that these services are affordable and that they can reach out bigger numbers of the population as it will be required in the future. So that is fundamentally the first reason why we have put this initiative forward, to bring attention of political and policymakers of the need to look into these issues, and acknowledging that these issues have been in many ways under the radar in the past and not given the sufficient political attention that they would deserve. The second element is really about gender. When we look at the figures, and we have brought to you some figures through the communication, we will see that this is predominantly an area that affects women because they are those who are normally informally caring for their relatives. It affects women because most people working in the sector are women, and also because when you look at old age, women tend to live longer, but also have much more problems to have access in terms of long-term care services, because very often they have lower pensions, they are more in poverty in old age. So this is really an initiative with a very strong gender dimension, and it is really a call to make sure that these issues that I've just mentioned of lack of affordable services, lack of quality services, and also related to the working conditions in the sector, these issues need to be addressed, because this is also about ensuring gender equality. It is about ensuring that women have the possibility of having options in terms of professional and their professional lives and their personal lives. It is about ensuring that they are better paid. It's about ensuring that when they get older, they are not the victims of accumulated gender inequalities that they have suffered over their life, but they also have real access to quality services. So this is the second point. The third point relates to having a close look to the working conditions in the sector. When we look at what is going on, and the minister and yourself, Masay, already mentioned COVID and what has happened during the pandemic, we really see the stress and the difficult conditions in which care workers go through in their normal daily professional lives. And with COVID, which was a very stressful moment for our entire society, all those weaknesses were even more augmented because of the urgency in acting. When we look at the level of pay, the working time, the type of contracts that people have, these are all below, or very often below, the minimum standards that we would like to have in a equal and fair social Europe. And putting this agenda on the table is also saying this sector needs to be part of the political debate. It cannot be under the radar. It has to be discussed. Now, of course, we have workers that work in, let's say, organized settings, but we also have workers working in the domestic environment, what we call domestic workers. And these persons are even more far away very often, or not protected by the regulatory frameworks that exist in the member states. And if I add the fact that some and many of these people have a migrant background and very often are unprotected also due to their origin, this of course really needs to be a point of attention. So this, there will be many other reasons why we have put forward this strategy, but I think for me these three are worth mentioning here. Now the question is how we are going to implement what we have put forward. I think that one very good and very positive development since we have presented the strategy is that in Council, and the Minister has already mentioned to the work the Presidency has done, but in Council there has been an unanimous support to this initiative, and the discussions around the recommendation on long-term care have been extremely constructive and been very positive. So I think the reception of this initiative by the member states has been very good. Now, of course, a lot of it relies on them. And one of the discussions we had in Council was about how to go about it. How can we make sure that at national level there is an attention to these issues and that there is effectively an implementation plan being built. I'm not going to hide that this has been a difficult discussion. Some member states did not necessarily find the need to look into these matters. The Commission had asked the member states to appoint a coordinator, a national coordinator, to be able to bring the different elements of this agenda together at national level and bring a coherent implementation plan forward. This issue of having a coordinator was not always the most successful conversation, but I'm happy to say that finally everyone agreed to have a coordination mechanism at national level and that this will be used for the implementation. So this is a very important step, to have at national level an understanding that you need to bring different sectors, different actors together, and that you need to have a coherent and a strategic view about this. The second element, of course, is to make sure that these plans materialize concretely. Now, we have asked the member states to put forward their plans. Now, I believe the arrangement in the Council is 18 months after the adoption of the recommendation. Honestly, I do believe, given the complexity of the sector and the variety of issues that are at hand, it is important to give leeway to member states to really organize and come forward. But so we are really now looking forward to these plans, and in between, the Commission and certainly DG Employment will have a very active approach in reaching out to the coordinators where they will be appointed, but also to other bodies where this mechanism of coordination will be in place, to make sure that we have, let's say, a process towards these implementation plans that is discussed and guided and shared at European level. Of course, there is an issue of money involved in implementation, and I think that's money is always an important point. I think it is very promising to see that many countries, I think around 17 countries, have put long-term care as part of their RRF investment plans. So this is something that needs to be looked at and monitored. There is, of course, all the area of the European Social Fund, which can help investing on training for those working in the sector. There's the ERDF, which can help investment into a transition from certain types of services to home care. So there are a number of European sources, but of course, it is also necessary that national investment comes into the picture. Obviously, the European money will not be enough. So I think that is an important aspect of the implementation, and we should not obviously disregard it. Finally, I do think that we need to know more of what is going on. I do think that this is an area that, due to the silence for many years about it, we lack statistical data, we lack evidence that can actually allow us to go further. So the Commission is certainly engaged in looking into ways of reinforcing this data, so that maybe in the future we can be a bit more ambitious in terms of quantitative targets. And of course, the Commission will also support the member states in their projects in terms of reforms, and be with them to discuss the policies that they want to put in place. Finally, a word on civil society and social partners. They are part of the implementation. A lot of care services are delivered, for example, by cooperatives, by mutualité in certain countries. So they have an extremely important role in this agenda, and it is important they are part of the national conversations of this, the design of these implementation plans. And social partners. Let's, as the Minister said, a lot that is going on in the care sector is not covered by collective bargaining. There is no representation of social partners in the sector for a whole range of reasons. So it is important that this sector becomes part of the conversation also within the social dialogue of the member states, and that we certainly promote further collective bargaining in the care sector. So I leave it at that. I hope this gave you some hints for discussion, and I'm certainly happy to come back if you think useful. Thank you.
Thank you very much, Anna Carla. Indeed, extremely interesting, very rich. You shared with us a number actually of issues which clarify again on the ambition for this strategy, but also more importantly, as you said, how now looking forward, how this will be actually implemented with the efforts both on the national side, but also with the guidance and support that the Commission is ready to provide to member states. Thank you, of course, for your last final point about the importance of including civil society, social partners. Certainly from the perspective of our constituency, Age Platform Europe, our members who represent both older people themselves, but also service providers for older people. This is for us absolutely crucial to be part of this discussion because indeed as recipients of long-term care, but also as providers, you mentioned also informal carers, we believe that we have many things to be shared and to be taken into account in the debate. We couldn't agree more with what you said about the gender issue. I think it's been for a long time that this question was maybe overlooked. Age Platform Europe has been always very direct on this topic, saying that gender dimension must be also part of the discussion on the long-term care. It's, as you said, it's in relation both, actually, it's on the side of the provision and on the reception. I make also here the connection to what the minister said, for example, about adequacy of pensions. We know indeed that with the erosion of pensions and the poverty which concerns in old age, mainly older women, the question of whether long-term care is actually provided for free, what kind actually of support older persons, older women can count on. This is extremely important. Otherwise, putting out of our own pocket money for a service which is extremely expensive because it is labor intensive, and that means that is an expensive service. This, of course, then has a negative direct impact on older people who would need actually such services. To conclude, of course, we as Age Platform Europe, we were expecting maybe a little bit more on the quality standards when we were waiting for the strategy. We know that it's a complex issue, but you mentioned at the end as well this question of monitoring. So I think we believe that discussion on the data, targets, indicators, this will go on in the debate, further discussion between the member states and the Commission, and of course this coordination mechanism, so how concretely the care strategy will be implemented at the national level. I know you put the ball also in the, how to say, in the responsibility of the member states. That's why it will be also interesting today. We will have further discussion on this. So again, thank you very much for your presence. And now I will move to the last part of this opening session. And I have here a great pleasure to invite our keynote speaker. We thought that in this discussion, it will be also interesting to have a little bit different insight into, to give an illustration to this debate about quality, dignity, what are needs of older people. And we came with this idea of inviting, and I have a pleasure to welcome Ms. Anne Putteman. You are the journalist from the Belgian Dutch language weekly news magazine Knack. You carried out a series of interviews with older people, if I understand, mainly in Flanders, in Belgium, where you discussed autonomy, independence, but I would say more broadly, actually, this question of quality, what quality of life means actually to people in their daily realities. Therefore, Ms. Putteman, we are very much looking into findings to hear about what actually you learned, what you took from these life stories. And again, we believe that your contribution will bring a concrete illustration and meaning to our policy stakeholders, those who have already spoken, but also those who will follow today in this discussion on the reforms of long-term care with, again, anchored in the human rights, with the right to autonomy, dignity, participation. So thank you very much for being with us, and the floor is yours.
Okay, thank you very much for having me today. I'll just try to share my PowerPoint. So I hope. Okay. Doesn't seem, just a minute, it doesn't really seem to work.
We can see it, just not.
Oh, you can see it. Okay, I'll just, for one reason or another, it's going very slowly. Okay, can you see it now?
Yes.
Okay, thank you very much. So good morning, everyone. Today, I would like to speak to you on behalf of all my friends who live in care homes. Now, the past few years for my latest project with elderly people, Rebels, I've been interviewing dozens of people over 75, and quite some of them live in care homes or facilities for assisted living. Now, what most of them tell me is that they are really quite satisfied with the care itself. It's other things they're struggling with. And I brought some friends of mine with me today to explain to you what those are. Now, this is Lutgard. And Lutgard is, she moved to a care home, and it was really her own decision when she was just over 90. And she quite liked it there. She had a beautiful room, the food was okay, she made a friend. But after a while, she told me, my body is taken care of, is well taken care of, but they seem to have forgotten my mind. And that is something I've heard over and over again from elderly people who need care in a care home or at home. They tell me that when you get older and you need care, that everyone you meet, your children, your caretakers, your neighbors, everyone is always so concentrated on your body. They always want to know if you feel comfortable. If your opinion is asked, it's always about that body. Are you warm enough? Do you need a blanket? Is the hip pain bearable today? Isn't the soup too salty? Questions like that. And of course, it's important. It's important for us to take care of elderly people and to make sure they're comfortable. But as you and I know, that's not enough. That's not what makes life worthwhile. So I hear a lot of frustration with elderly people, especially in care homes, who tell me that their opinion is never asked about things that really matter for all of us. And then I'm thinking about their opinion about a policy in their town, in their neighborhood, in the care home, in the facility, whatever. But also their opinion about things we talk about all the time, like the war in Ukraine or the energy crisis. A lot of people taking care of them think they don't want to be bothered with that anymore, and they don't ask them about it. And people tell me that's quite humiliating, as if your opinion isn't worth anything anymore. So my message here today is that it's about time we start asking the right questions. And that means we start asking elderly people on their opinion about all sorts of topics, not only their body, but also that we don't just figure out if they're comfortable, but we ask them, what is it you still want to do with your life? Because a lot of them, they tell me they never get that question. And they're well aware of the fact that maybe they only have a few years or even months left, but that doesn't mean they don't have things they still want to do with their lives. And I asked this question over and over again, I think about 100 times. And every time the person sitting in front of me, without hesitation, answers, because he or she always has things they still want to do with their life. And I'll introduce you to another friend of mine, Edwige. Edwige lives in a facility for assisted living. And when I asked her, what is it you still want to do with your life? Immediately she said, I want to make this facility a better place to live, an even better place to live, not only for myself, but also for all the people who will move in here when I'm long gone. So Edwige is very active in the Residents' Council. And also about 6 months ago, they needed a new residential assistant. And for the recruitment, it was Hedwige and 2 other residents who actually conducted the interviews with the candidates and who chose Anne, who is now the residential assistant, which is quite logical because a residential assistant works for the residents. Now, this is a really dear friend of mine, Leon. Leon is in a wheelchair. He doesn't have any hips. In daytime, he cruises around the little town of Wevelgem on his scooter, as you can see. Now, Leon is very fierce. He's very outspoken. And when there's a problem, when there's something about the care or the food or whatever in the care home where he lives, when there's something he has problems with, he just goes to management and he says what the problem is. But when I just met him, he told me that a lot of other residents in the care home aren't that outspoken. They're even a little afraid to tell the staff that they have a problem with something. So he proposed to management to be appointed as a sort of intermediary, and they accepted. And now, if other residents in the care home. They have stuff bothering them, or they have problems with caretakers, whatever, and they're afraid to go to staff or management. They just go to Leon, and then Leon passes it on. And he says for him that's very important, because he actually has the feeling that he can make himself useful. And even though he has no hips left and he's in a wheelchair and he has a lot of health issues, for him this is extremely important to be able to do that. Bernice. Bernice lives in the same care home as Leon. Actually, they're quite good friends. And Bernice has a problem with the food in the care home. She's not particularly fond of it, but next to that, she's also angry that so much food is thrown out every day. Especially because a lot of residents, some days, they don't even touch their plate. They just throw it out. And that also happens with fruits, because even though the fruits in the care home are cut in pieces in fruit salads, quite often there are pieces too hard to chew, so it's thrown out. And she says it's important we get our vitamins. And she hesitated for a while, and then she actually went to management. And management asked her, well, Bernice, okay, we understand your complaints, but instead in just writing down the complaints and throwing the apple and the pear out of the fruit salads, they asked her, Bernice, what do you want to do about it? And Bernice really loved that. The minute she got the question, she started giving all sorts of ideas and proposals, because when she was younger, a big part of her life, she actually worked in kitchens of hotels. So she knows a thing or two about food and food processing. And a few of the proposals were actually implemented. Like now, the residents, they don't get fruit salads anymore, but they get smoothies. And I haven't been able to taste one, but I've been told they're really good. Now, you're probably thinking, well, that's all okay, but not every over 80 person who needs care or who lives in a care home is so outspoken, even rebellious as Leon and Bernice and Hedwige. And also sometimes they're just not strong enough, or they don't have the personality to actually go and speak for themselves. But let us not be mistaken. It's not because people don't come forward with their opinion or their complaint, and very, very importantly, with their dreams, with the things they want to do with their lives, that they're not there, that there are not things they want to do, they want to say. With them, it's even more important to ask the right questions, because if everyone who came in the room of Bernice just asks, how are your legs today? How's the pain today? She might never propose to make smoothies. And in her life, that's very important. So I'll give you another example. This is Maria, and Maria is the lady with the red vest and the reddish purse. And Maria lives in a care home where every 3 months or so, staff goes up to all the residents and asks them what they still want to do with their lives. And when the head nurse spoke to Maria, Maria immediately said, I would so much like to go into the town, to the little knitting shop, because she's knitting all the time, and buy some wool. And the nurse was actually quite surprised, because Maria has cupboards full of wool, all colors, all kinds of needles. And then Maria explained. She said, I would really feel myself again, I want to be there. I want to be able to look around myself. I want to be able to touch the wool. I want to be able to choose for myself to smell it. Now, they organized it because it wasn't that hard to organize, of course. They organized it, and for her, it was really what she wanted out of life. And I think that's something we as younger people should bear in mind, that things that look at that seem details in a life that we don't even think about can be very important. When you get older, you need care, you're less mobile, and your world is gotten a lot smaller. And I'll tell you a story that for me really proves the importance of asking the right questions to elderly people who need care. And it's a story about a woman. She's in her 80s. She's terminally ill. She can't get out of bed anymore, so she's taken care of in bed. And everyone knows she doesn't have that much time left. She moves into a care home where every new resident is being asked, is there something you want out of life, you want to do with your life? So a nurse comes in to her room, the lady's in the bed, and to be quite honest, the nurse, she doesn't really expect an answer because she thinks the lady, she doesn't have a lot of time left, she's ill, she won't want anything else out of life. But the minute she asks the question, the minute she asks, what would you still like to do? Immediately, the lady in the bed answers, I would so much love to see the clouds again. And the nurse doesn't understand, because as you all know, rooms in care homes might be small, but they do have windows. And then the nurse, she goes up to the lady and she puts her head next to hers in the same position, right next to the bed. And she looks through the window, and what does she see? She sees passers-by, children, the neighbor walking her dog, and she sees traffic, but she can't see the sky. So what they did, they rearranged the whole room, the furniture, the chair and the cupboard and the table and the bed, just until the bed was in the perfect position to see the sky. And the lady lived for another 3 months in that bed. And for those last 3 months, she got out of life what she wanted. She could see the clouds. Now, I think this is really a beautiful story. It's sad in a way, but it also gives hope, because it shows us that asking the right questions gives us answers that we can really do something about, because actually it's quite small things that can give people a reason to live, give people fulfillment, much more than just keeping people comfortable. So if we go back to the beginning of my story of Lutgard, the woman who said they're taking good care of my body, but they have forgotten my mind, I think the story, the cloud story, proves that it's not so difficult. It doesn't take that much time to actually make people ask the right questions, make people feel that there's attention for their mind, and especially for the person within the body needing care. So my message to you is, let us all, caretakers, people responsible for making policy, but also neighbors and children of elderly people, let us start by asking the right questions. Thank you very much.
Thank you very much, Anne. What an excellent illustration to, as we said, to the principle, to the of the right to live in autonomy, independence, to our participation, to our inclusion. Thank you very much, Anne, for bringing today your friends, all different Lutgard and all the other persons that you met. They are not with us physically, but I think with the testimonies, with the powerful actually messages that you have just brought to us, I think we are with them. I just take, because we have very little time, so we will need to move to the more technical discussion, but I think having this insight into what people, older persons wish and want when they leave, I think it gives, it speaks for itself. So the next speakers, I think they will be, I hope, inspired in their own reflection on how we want to shape long-term care. I just take two, I would say, words from what you said. It's basically about giving the voice to older persons, but also to make sure that this voice is heard. This is basically what we are talking about. We have to finish about patronizing older persons when they need in care, and when they rely on someone who provides support, they are as equal in their being a person in their life as anyone else. So to conclude, indeed, we all want to see the clouds till the very end, and I think this is the perfect illustration and the motto, I would say, to the discussion on how the care strategy, what it should look, what it should actually bring in concrete terms to older people's, but also to everyone, because we spoke about the strategy. It's actually not only about older people, it's about also childcare. So anyone through the whole life, whenever we need care, we always have a word to say what we wish and how we want to live. Thank you very much for your contribution and for being with us. So now it was extremely, I think, already fascinating, interesting to have our three speakers. Now I take over the moderation to our Vice President, Anthony De Giovanni. We are moving in our program to the first part, building a right-based approach to long-term care. Again, sorry, we are a little behind the schedule, so I hope that we will manage. Sorry, Anthony, that I actually give you this difficult now task, but I think that we will manage this. So let's then switch. You are already with us on the screen. Then please go ahead. We open then the first part of our conference.
Thank you, Dr. Kucharczyk. It is indeed my pleasure to moderate this first panel of the conference, but I must say that Ann Petzman's keynote speech does make my tasks much, much easier, because it sets the mood and the appetite for the ongoing discussion. The theme of the discussion is quality care guaranteeing independence for persons in need of care. I welcome the panelists, who are Dr. Natasha Atsopardi-Muscat, Ms. Katarina Ivanovich-Nesevich, Dr. Hiji Horeski, Ms. Caroline Kostongs, and Minister Sergio Murillo. The panel discussion will take, I don't know, about 80 minutes maybe, and after each panelist will give a brief introduction. Questions from the floor and chats are invited. Without further ado, I have the honor to introduce the first panelist, who is Dr. Natasha Muscat. Dr. Natasha Muscat is Director of the Division of Country Health Policies and Systems, World Health Organization Europe. The WHO is coordinating the UN Decade on Healthy Aging and has released the WHO framework for countries for achieving an integrated continuum of long-term care this year. Dr. Natasha Muscat, the floor is yours.
Thank you. Thank you, Dr. Anthony. I extend my apologies from Dr. Atsopardi-Muscat, who is unable to make it. She is actually speaking to the minister at the moment in another meeting. So I will be speaking on her behalf from WHO Europe. So thank you.
Thank you, Dr. Yon. Please carry on.
Thank you. It is our genuine pleasure to join you today and for this timely discussion. And let me first start by thanking Mr. Maciek for inviting WHO Europe to this annual conference. And we're very pleased to have a very long-standing relationship with AGE, and we thank AGE for the unwavering commitment to ensure that the voices and the needs for older adults are taken into account in European policies. And indeed, we need to ensure that older adults are never left behind. So coming back to the questions of this panel, let me first remind everyone that the WHO has proposed an operational definitions of long-term care services. as the range of personal, social, and medical support and services to ensure people with or at risk of significant loss of intrinsic capacity can maintain a level of functional ability that's consistent with their basic rights and human dignity. So the goal for long-term care provision is to provide dignity and the fulfillment of human rights by ensuring people can continue to lead meaningful lives as independently and as safely as possible, despite declines in functional abilities. So the question is, how can we achieve these goals? Well, first, by designing long-term care service that can integrate into health and social support service package and to respond effectively to the needs of care users as these arise and progress. Second, by working to ensure care services reflect the preferences of care users, their informal caregivers, families that are aligned with their cultural values. And finally, by delivering care for as long as possible in those settings that allows users to remain as active and as engaged as possible in the local social networks. But if we are to make significant progress, both on integrated care and improving access to long-term care services, ambitious reforms are needed to align long-term care delivery with universal health coverage agenda, as we heard this morning from the deputy ministers in Czech Republic. We must work to ensure universal coverage for a basic package of long-term care services as part of the continuum of care that spans prevention, health promotion, curative, rehabilitations, assistive, and palliative care to allow care providers to deliver timely and appropriate care in a continuous manner throughout the life course. And by mainstreaming the continuum of care, we further facilitate the reorientations of care models towards an integrated, but also a protective, proactive, and preventative-oriented approach, which aim not only to mitigate, but also to prevent and rehabilitate functional decline. And this is essential in order to minimize periods of capacity loss and achieve the highest quality of life, but also for a system sustainability perspective. And it is wonderful to see that the care continuum and the integrated delivery of long-term care recognized as key priorities of the European care strategies. This signals a clear commitment from the European institutions to support member states in strengthening their health and care systems, and the WHO Europe is proud to be part of this joint effort. As part of this collaboration, we will work to develop monitoring tools and carrying out detailed care systems assessments and gap analysis in cooperations and collaborations with key stakeholders in every country. The goal is to build a knowledge base, facilitate exchange and joint learning, and to develop a customized recommendations for the key components of integrated care and long-term service delivery. The best solutions and reform pathways would depend on each country on a series of highly contextual factors. But by and large, we will work to support the development of integrated and personal care pathways, to harmonize of entitlements across the health and long-term care sectors, and to promote collaboration across governance levels between formal and informal care providers. Another important part of the collaborations will focus on protecting, enabling, and promoting health and well-being of the care workforce. And this means both the formal and informal, already placed under considerable strain before the COVID pandemic. Formal and informal caregivers have been faced with psychological stress, heightened workloads, isolations, and care burden. And this is reflected in difficulties to attract and retain formal care workers, both in residentials and in community-based care settings. At the same time, the share of informal caregivers that report increased strain have negative impact on their physical and mental health, has risen significantly during the pandemic. The many millions of informal caregivers across Europe are in need of protections and support, and the WHO team will prioritize the development and support tools and guidance that can enhance knowledge and care skills so that they can better care for themselves and others, so that they can care for themselves and ensuring caring does not become a risk factor for their health and well-being. So in conclusion, we have three key actions that we would like to work together. First, we need to improve accessibility of long-term care services and mainstream care continuum. Second, we have to transform the prevailing models of care through reorientations towards the preventions of functional decline and service integration. And finally, we must increase public investment in the health and care workforce, both informal and formal, both formal and informal, particularly through initiative focusing on education, development, and protection. From our perspective, we look forward to work in partnership with all of you, because innovations for greater good that benefit everyone is something that only happens when we work together. So in this spirit, we would like to thank H again for inviting WHO Europe and to assemble a great program for this timely discussion. Thank you very much.
Thank you, Dr. Yon. Am I to understand that you are staying with us during the whole panel? Thank you very much. So I will now introduce the second panelist for an introductory speech, who is Ms. Katerina Ivanovich-Nesevich. She is Director of Social Rights and Inclusion Commission, Directorate General for Employment and Social Affairs. DG Employment and Social Affairs have been the pen holders, as it has already been said, for the long-term care related to parts of the European Care Strategy. The floor is yours, Ms. Ivanovich-Nesevich.
Thank you very much, Anthony, and good morning to all. Also, big thanks go to Maciek for organizing this important conference. And of course, I always thank you, all the colleagues from AGE, for your, indeed, as my colleague from the cabinet of the commissioner said, your contributions have always been super helpful, useful, and I believe we can recognize some of your fingerprints in the care strategy. The topic that I want to reflect more in my presentation is indeed on the quality of the care. And for us, the quality of care is important from many perspectives. First of all, for persons who are receiving a long-term care, we believe that the quality can improve, it can prevent the deterioration of their physical and mental conditions. And also it can enable their independent living and their personal well-being. And in some cases, I think we can all agree that the quality care can really mean the crucial difference between life and death. For people who are providing care, the quality means that the better working conditions, it means to the support in developing their skills and also support in developing their careers. If we take a look from the economic perspective, then for us, the better quality can really help to avoid unnecessary hospital or unnecessary residential care admissions, or it can slow down the deterioration of physical condition and potentially alleviate the pressure on resources, which is something that it's really always quite useful to look into. And then in the end, for the society as a whole, we do believe that the quality of long-term care services really determines the ability to uphold the fundamental rights and dignity. Anna Carla gave you the overview why the long-term, the European Care Strategy, and you know it well. It was adopted on the 7th September this year for me, it seems like it was adopted long time ago, and we have used so many opportunities to present the care strategy and to accompanying recommendations, but it has been only a bit over 2 months ago. And with a care strategy, we adopted 2 accompanying proposals for council recommendation, one on childcare, the revision of the Barcelona targets, and one on the long-term care. Both of them are in the final stage of discussion and negotiations with the council, and both of them are expected to be adopted towards the end of year. Indeed, the negotiations were very, I would say, challenging and stressful occasionally, with a number of topics that different member states understood in a different manner. But I would still say that we have managed to preserve the high level of ambition, which was seen in the initial proposals from the Commission. But let me come back on the care strategy and on the messages on the quality and the care quality and high quality is very important. And in the light of the care quality in the communication, we mentioned several activities. I would just quickly mention them because I prefer that we go in later in the Q&As, and I'm happy to reply indeed on many questions. So what we have ensured that there is a direct technical support from the instruments called technical support instrument, which is meant to help the member states in the design and the implementation of their reforms, which are aimed at strengthening the coordination between health, social care and long-term care, by indeed, and never enough to highlight, by putting the person at the center of services. Then with under the Horizon Europe program, a knowledge hub for innovative technologies and or digital solutions will be financed in health and care provision in order to support the assessment of transferability of good practices and act as a community building and exchange forum. Then, complementing these elements, we will make sure that we do finance research and innovation for person-centered care and uptake of digital solutions. And this will be done together under Horizon Europe, but also the Digital Europe programs. And then, as we have heard, we will set up a strategic partnership with the World Health Organization to provide a country-specific support in design and in implement policies measures for high-quality long-term care, including also through the integrated care services. Very important aspect that has impact on care is also development of the proper social dialogue. And we are aiming towards starting and strengthening the sector of social dialogue for social services at EU level, and then support for the capacity building for social dialogue at national level. We are also just starting the review of the application of EU standards on working conditions. And then we are developing specific skills partnerships under the Pact for Skills. And we are establishing the task force on the long-term care statistics to improve the evidence base of long-term care. You can see just by listing these important elements, there are indeed many activities that will be practically in parallel ongoing in order to address the challenge, which is the care quality. Then in the council recommendation, the Commission proposal invites member states to establish a high quality criteria and also standards for all long-term care settings. This is very important, all long-term care settings, being private, being public, being in partnership. So all kind of care settings should be implementing the quality standards. then these quality criteria have to be tailored to their specific characteristics and apply irrespective of their legal status, as I said. Member states are invited to have in place the quality framework for long-term care. And this quality framework is guided by the principles that are set out in the annex of the recommendation. And in the annex, I will just tell you which are these principles. I'm not going in the details because it will take just too much time, but the principles include the respect, the prevention part, the person-centeredness, then the comprehensiveness and continuity, focus on the outcomes, transparency, part on the workforce, and part on the facilities. And in this adequate quality assurance mechanisms, the member states have also been further guided by the need that they need to enforce the compliance with a quality regulation in collaboration with long-term care providers and people receiving care. I believe when you take the care strategy, you can always see these two elements. We have the element of those who are providing care and those who are in need of care. And this is visible throughout all the documents, care strategy and both recommendations. Then there is this importance on incentives and capacity building for providers to go beyond minimum quality standards and to improve quality continuity. And the need to secure sufficient resources for quality assurance at all levels, national, regional, and local, because we know that care is provided at all those levels. And then another important element is the integrating quality requirement in the public procurement and the need to promote the independent living and inclusion in the community in all care settings. All of this is not, of course, possible to be done just by the national authorities or nationally partnership with public providers or private providers. This needs to be done in cooperation, as I said, with those who need care. The civil society and social partners, I would dare to say, play a crucial role. We are aware that in many member states, the providers of the long-term care are the civil society organizations, be it like a Caritas or a similar Eurodiaconia or similar Red Cross or similar organizations. And that is why it is important, whenever discussing about the quality, whenever discussing about the implementation of the recommendation, to involve those stakeholders. And I think we can never highlight it sufficiently enough. And with this message, I leave the floor for the further discussion. Thank you very much.
Thank you very much. It seems that Dr. Hiri Horeski has got a technical problem to contact us, so I will move on to invite Ms. Caroline Costangs to make her short delivery. The floor is yours.
Many thanks, Anthony. Can you hear me? Yes?
Yes, yes.
Okay, so thanks for the kind introduction, and thanks a lot to H Platform for inviting me here, and hello to everyone. A few words on EuroHealthNet. So EuroHealthNet is a European partnership of national public health institutes, regional health authorities, and research organizations and civil society working on the ground. And our main mission is to reduce health inequalities and to tackle the underlying social determinants of health. And years ago, we were part of a European study on healthy aging, which was led by the Swedish Federal Agency for Public Health. And we reviewed the scientific evidence base for healthy aging. And one of the findings that struck me then is that health promotion and prevention is still possible even in very high age groups. So there are health gains to be made. It's never too late for health promotion and disease prevention for older people. As an example, one is never too old to start being physically active. Of course, it's important that the activities are adjusted to the health of the person and their functional capacity. So I therefore argue that health promotion and disease prevention are crucial to maintain and to regain independence of older people, and they must be a central part and integrated into care services in order to improve their quality. In fact, I would like to say that we need a mind shift, really, that we organize long-term care and care environments in such a way so that older people can remain active in society and participate in the community. The dependency on care is not really a fixed state or static. I think all during our lives, we move in and out of vulnerability or independency of care. Of course, the need for long-term care can increase when we grow older, but it can also diminish or even disappear. So the definition that we use for healthy aging is as follows. Healthy aging is the process of optimizing opportunities for physical, social, and mental health to enable older people to take an active part in society without discrimination and to enjoy an independent and good quality of life. And in my view, the aim of long-term care services is to really make this visible, also for people that experience a significant loss of their capacities. So long-term care services should provide opportunities for healthy living, and this means the following. First, it's important to create the conditions and opportunities for people to have regular physical activity, and I would say to really focus on the muscle strength and body balance, to provide healthy eating habits, intake of vegetables in particular, to be able to have social relations and networks, and also meaningful activities to do. Long-term care should also provide psychotherapeutic and psychosocial interventions in order to promote mental health of older people, and should include the more standard services, let's say a smoking cessation, light alcohol use, the quality check of the use of medicines, providing vaccinations, but also, for example, to make sure that the impact of the climate change is not felt like the heat and the very cold. So strengthening health promotion and disease prevention is really important to have that as part of policies that steer long-term care, because it can indeed also delay the need for care. And I'm therefore very happy that the European Care Strategy is referring to healthy aging, which is an opportunity for us now to take this further and develop it and exchange the various good practices that are out there. There's one good practice that I wanted to share with you from Austria. They have set up this community nursing project where community nurses are very much supported in their work, and they provide low thresholds and needs-oriented care close to home. So the nurses, they act as central networking points, and they link all the people with the health care and long-term care service providers in the community. And this project is developed by the Health and Social Care Ministry and the Austrian National Public Health Institute, and it's funded under the Recovery and the Resilience Plan of Austria. Of course, we shouldn't wait with healthy aging until people are making use of long-term care services, because healthy aging, as you know, starts even before we are born. So in general, EuroHealthNet argues that we need public health prevention and promotion that takes this life course perspective, that takes a health in all policies perspective. So it's very much working across sectors with health, social, housing, for example, that we include an equity lens, because health inequalities generally accumulate across the life course. And we need to put extra effort for those people, those older people that are living in poverty or with difficult socioeconomic conditions. We have to protect against catastrophic health spending, for example. And we need to make sure that we move public health and promotion and care services into the community, which implies creating age-friendly environments, but also think through public transport issues or mobility to allow people to take part. We have therefore to work bottom up, very much with local authorities on the ground, civil society on the ground, and empower people, and what we have heard through the various presentations, and make sure that we include all the people in the design of the supportive strategies that we want to have in place. And we have to monitor this and define further the healthy aging indicators that we have, make more use of healthy life indicators, and use these indicators also to help decision making in terms of budget allocations, to see where we can invest, where we can disinvest. For example, we may underspend on prevention, but we may overspend on more specialized treatments and care. So in conclusion, Anthony, I think that boosting health promotion and disease prevention is really key for the quality of long-term care services. It's really great. It's part of the European Care Strategy. Well, it's great to have the European Care Strategy in the first place, of course, but it's good that it's in there. It's great that WHO is active. And I just heard from Katarina, the partnership that she announced between the Commission and the WHO is very important. And we would be happy to be part and support, because it provides major returns for people and for all the people in the first place, but also for society in terms of workforce participation, in terms of quality of community life and social cohesion. And I think that this all also contributes to a more, let's say, economy of well-being, which is a framework that also brings a political commitment, which is also so much needed to advance this agenda. Thank you for this, Anthony.
Thank you very much, Caroline. Caroline is director of EuroHealthNet, the European Partnership Promoting Public Health, Disease Prevention, Promotion, Health and Well-being, and Reducing Inequalities. Mr. Costons is an expert in public health and health promotion particularly. And now it is my pleasure to introduce Dr. Jiří Korecký. He is president of the European Aging Network, EAN, member of AGE. EAN groups more than 10,000 care providers across the European continent. Mr. Korecký comes from the Czech member of EAN. Dr. Korecký, the floor is yours.
Thank you, Anthony, for giving me the floor, and thank you, H Platform, for the possibility of joining this great event. I have just a few opening remarks on the topic of quality in long-term care and social services generally, also link to the EU care strategy that has been mentioned several times during this event. It tackles all the numerous challenges in long-term care. So I would like to give you, in relation with quality of long-term care services, also the perspective of the long-term care providers in Europe. So first of all, we are happy that the European Commission is paying that much attention to the long-term care, not only on the basis of why the care strategy, but also long-term care reports and other activities that have been there for the last couple of years. In particular, we are happy that the EU care strategy tackles the main important challenges, and that are, for example, the service quality, to guarantee a high quality, not only of care, but a high quality of life, because we too often are concentrated just on the quality of care, but we should see beyond that. We should see our clients and the care recipients and monitor their quality of life, not only the care we are providing, but asking beyond the care we are providing, especially linked with the care of the body that was also mentioned earlier here. We should concentrate and we should provide the long-term care services on the person-centered care basis. I would like to maybe correct this approach a little, because we indeed are talking about person-centered care, but we think it should be more person-led care, that our clients and the care recipients and the seniors should be the leader of the care. There should be indeed be in the center of the care, but there should be the ones that are leading it. So we should not only speak about person-centered care, but also person-led care. We are happy that the EU care strategy contains also investments and financing issues, social services, yet it's very important to discuss that long-term care stays accessible and also financially affordable to the care recipients, to the clients in Europe. If you read the care strategy, the one special part is about workforce issues, about the staff shortages, about how to recruit and retain staff. Because if you talk about quality, it's almost about the people providing the service. And that this is not only about qualification. You have to have good quality people providing the care. You have to have good people providing care. It doesn't matter whether in care homes, in nursing homes, in home care, in respite care, in daily care center. So if you are not having a good quality workforce, it's very hard to guarantee a good quality service and to guarantee a good quality life of the people that we are providing care to. With this issue, there are a lot of problems. Undeclared work, domestic live-in carers, legal migration issues that can be or that can remedy the labor shortages, brain and care drain in Eastern European countries, and ethical dimensions causing problems in those countries sometimes. We should also tackle the challenges for care workers from Ukraine currently in some of the European countries where this is an issue. And it's also important when we talk about work migration to talk about fair and ethical work conditions and also integrating those people. And other topic that wasn't mentioned here, but we think it's also linked with quality of care and life is also the upcoming digitalization of social services. That could be a topic of a separate conference, and even talking how the digitalization can indeed enhance the quality of services, can raise the safety of the clients and also safety of the workforce. When we talk about funding, we are very happy that in the context of EU funds, it's used in relation with how to improve equal access to high quality long-term care, and in particular, community-based and home care services, because we think that the long-term care systems must be redefined, must be reshaped so that they would be also fundable for the next years to come, that they will stay also accessible, and that we will not be forced to lower the quality in order to remain the accessibility and affordability of the services. To conclude with three final points, we see the EU care strategy as a very positive signal, that European Commission, let's say, cares about long-term care systems, and especially about people that are receiving the long-term care services. We see it also as a very good signal and incentive towards the member state countries. We are looking forward to the action plans that as an output of recommendations should be there in the member state countries. We think that, and it was already also mentioned here, there should be more indicators and maybe an EU action plan. So an action plan on the European level could be considered as a follow-up activity on this EU care strategy. We should put more accent on the person-centered and also person-led care, as I explained a couple of minutes ago. We should also concentrate on the staff in relation of the quality provision. We should keep in mind that good quality provision and good workforce is something that is in one line, and we have to be aware of that. And we should also leave the medical and body approach, and we should come over to the holistic approach, seeing also the mental and spiritual health of the clients, of the seniors, and concentrating then on the basis of this holistic approach on the whole quality of life of the people, so that their life will stay as meaningful as it's possible also till the end, as we heard it also from Anne in her presentation. So that's my opening remarks for this discussion. Thank you.
Thank you very much, Dr. Horeski. It's very pleasant to hear, both from the providers and from the regulators, a direction towards a holistic approach. And that, I think, will continue with the delivery of Minister Sergio Murillo, who is Minister for Social Affairs of the Biscay Provincial Council in Spain, which organizes the care services for thousands of citizens in the province. He has worked together with AGE to reform the province's approach for long-term care based on an empowerment model, developed by a team of international experts. Minister Murillo, the floor is yours.
Thank you really much, Mr. Anthony, and thank you really much, H Platform Europe, for inviting us to take part in this conference. I just will share quick slides, will take not too much time, but I wanted to support my speaking with some slides, few slides. Okay, first of all, just to present ourselves, we have quite a strong self-governance, and with full power of taxation and a lot of care management, delivering care to many people in our region, which is just 1.2 million inhabitants. It's true that we are quite, our life expectancy is quite high, even over the European Union life expectancy, and the challenges of aging are present, and even more present than in other areas of the European Union. But nevertheless, and on the aging strategies, we have been running with many strategies up to now, and trying to be coherent and building up a governance and some care strategies that are coherent with the rights approach that we do have in our region. With running from the Council of Elderly People since 1999, the active aging policies and active aging index measurement since 2003, 2012, and reference site on active and healthy aging. But let's go into the framework and what I wanted to share, looking at the guarantee of independence for persons in need of care. From our point of view, the first challenge is building up the framework. The framework may answer almost every question that we do have in the process of delivering care. Maybe there are some answers if it is healthcare versus social care, community versus institutional care, informal versus professional care, digital versus personal care, and residential care versus home care. It's about healthcare plus social care. That's what we have to talk about. That's the framework. The institutional responsibility, we have to assume it as a public good, which is care is a public good, and having the right to have care is a public good. So we have to take care of it from institutions, but we need community involvement, and both are compatible. Both have to work together. And it's not about informal or professional care, but about shared care between professional institutions and a community and the informal carers. And digital and personal care. Digital care does not mean avoiding personal care. And care at home, and like at home, if not possible, or if not desired by persons in need of care. So as a conclusion for my first challenge is, let's recognize ourselves as interdependence. Let's assume public responsibility on care if it is public good. Let's recognize that services can be complementary and are complementary. Let's avoid excluding informal carers at the community as active care agents. And let's look at life course as a whole, not only at very late, very specific moments of late life. So let's embrace complexity. That has been a work that we have been doing up to now in our region, and I need that it is one of the principles within everything we do, and what I wanted to share it. It's necessary for guaranteeing the independence of persons in need of care and the quality of care. But the second challenge is to identify the real aim. And I underline this about the real aim because sometimes, and I think that Professor Horecki perfectly underlined up to now, that it has to be led, the care has to be led by persons. But I will go a little step forward, because it's true that this was the old paradigm in which we protected the most vulnerable ones, bringing them out of society into some spaces or some ecosystems in which they had the protection. Now it's the other way around. People, everyone, even people in need of care, does have a life project, even if the remaining days are very little. There is a life project there. We have to recognize this. And our duty is to transform environments, to be enablers of that living project, and to give support to that people at every moment. And this means changing the subject for us as public authorities and providers to be the object of the phrase. So people is leading their life project with care, with need of care that has to be guaranteed. But first of all comes the person that is leading the life project, and then afterwards the support, the environment is enabling or is not enabling, and the support has to be stronger or lighter. So how did we do the last step in the last few years? So we started our way forward was our expected work before pandemics, deployment the care statute, deploying a new service with telecare from a daycare center, and trying to bring and to gather all the agents, everyone involved in care, recognizing that paradigm of people is leading their life project, and we need everyone to be aligned to this life project, to support this life project, to transform the environment. We needed a debate, a new concept, which was not very well known in our region, which was long-term care. Long-term care could bring to the debate health systems, informal carers, social care, professional care providers. All of them have been there in the debate. It was the process we ran was organized back to back with H Platform Europe, which was organizing a group of experts. Those were the group of experts. Sarah Harper from Oxford was chairing it, and they deployed last September a complete report, which came to be, the title of it came to be Empowerment Care Model. So coming from that point, which is the new step that we have to go in? Those are the lines, the working lines that I am not going through them, that we are deploying right now at policy level in our region. I won't go through them. I will share the slides with you, so you can have the chance to look at them, and I will be very ready for more explanations. But which is the new step in policy making approach? Okay, we have concluded, and we are working from considering long-term care as a whole ecosystem, whole asset, because some services can be complementary, and sometimes if we have to combine different care, kinds of care. Second one, long-term care is supporting micro ecosystems, as it's looking at the very concrete, specific ecosystems around the person, and a person that is in need of care. And even if it is in need of care, even if he or she is impaired, he is leading and he has the right to lead his own life project, and we have to ask him in advance, or at the moment, or at both moments, which is the objective of his life at this very moment. So, and this is the last step that I wanted to share in this conference today. This means not only that person is leading the life project and is leading care, is that we as public administrations, public authorities, we have to change our role. We are not the prescriptors. We are not the ones that know what has to be done. We just will be the advisors. We just go to the backstage and say, what do you need if you need any help or care? But we are not the subject of the phrase. We are the objects. We are secondary actors in this play role. And we have, in that sense, and coherent to this, we have to pass from care plans to life plans that include care. And that's what we are doing now in residential care and so on. But this is very much what I wanted to underline. And a new step, just looking at the care strategy at EU level. We welcome it. Of course, we really appreciate the effort. We really appreciate that it is in the agenda, in the European agenda, in the States agenda right now. But if we ask ourselves, where are the care ecosystems and who can support home care ecosystems, these are very next to people in need of care. These are just at local and community levels, and we need, and that's my last point, we need multi-level involvement to deploy a real, effective, and right approach EU care strategy that promote persons' independence, even if they are in need of care. If not, we are afraid that maybe we will again improve care provision, but we won't improve that much the life projects of people in need of care. So that's what I wanted to share. I will be for the questions and for the debate right now with you, and you of course can have my slides for further reflection. Thank you really much.
Thank you very much, Minister Murillo. Unfortunately, we don't really have a lot of time for discussion because we have overrun our time, and I apologize with the participants, but if they would like to put on questions on the chat, they will be certainly taken into consideration. So we have a little bit of time yet. We're bound with the interpreter, so I have to end this session at 11:30. And so maybe I can revert back to Dr. Yon when he mentioned knowledge exchange and joint learning. How does this align with the efforts undertaking as part of the United Nations Decade of Healthy Aging? And how can WHO Europe and European institutions, and I revert now again also to Ms. Ivanovic-Nesevic, so how can the WHO and European institutions support member states to actively participate in knowledge exchange activities? Dr. Yon, can you please take the floor? I'm not seeing Dr. Yon, so I ask the same question maybe to Katerina. Yes, the floor is yours. Put on your mic, please. Put on your mark.
Yeah.
Okay.
Now, yes.
Please be short.
Well, it's not easy to be short when there are so many things to be said. I would dare to say, but I want to point out, and I know that we don't have much time, the issue on the partnerships. And Anthony, was your question referring to the partnerships between or in general, or specific one?
Well, exchange of knowledge so that the member states would be more empowered in order to implement also innovation in the area.
Exactly. So when I said the partnership, I meant the partnership between EU and the member states. Exactly. And what do we have? You know that the recommendation, for example, on the long-term care is a soft form of soft legislation, because it is not binding like directive or regulation or any other kind. But what do we have? We have many soft tools, and we have the whole open method of coordination in order to implement our policies. In concrete terms, in the area of long-term care, indeed, we have asked for the national coordinators or similar coordinating mechanism to be established. There will be lots of mutual learning, a different type of mutual learning, in order to exchange, first of all, among themselves, and then also inform us at EU level about the developments. And also, we would use all the existing tools like European semester, like the Social Protection Committee, and all the others who have something to say and who will be able to address the state of play in the area of long-term care in the member states. So the mutual learning, the open method of coordination, and lots of peer pressure, I would dare to say, in order indeed for all of them to implement the different aspects, not only the quality standards, but all the aspects of the recommendation. Thank you.
And I would like to address this question to all the panelists, including to include the prevention, awareness for, and fight against abuse and neglect in all care settings in directions. So what would be your reactions to this question? Maybe Caroline can tell us something about it.
Yes, thanks, Anthony. It's an important question, but I would very much like to support what Sergio has presented to us just before. I thought that was really an excellent example, very inspirational, and I would say also very forward-looking, giving a pitch how we should reform our long-term care services and how people should be in charge of their own life projects. And in that case, if people are more in charge of their life projects, then abuse will less happen. But I wanted to ask also for Sergio, I do think that there is a risk in widening inequalities, because not everyone has the health literacy or the motivation or the capacity or the opportunity to make those decisions. So yeah, that is, I think, a worry that I have. And I saw in the chat that there was a question about the cost effectiveness. Indeed, how is it in terms of funding sort of this more integrated model where you bring so many stakeholders together? Yeah, how does that work funding wise? But sorry, Anthony, I was just very much interested in that example.
Yeah. Okay, so if I would like to ask another one, the difference between services for persons with disability and long-term care to older persons. Is there a segregation between these services, and is it a sign of ageism? I would ask maybe Mr. Oreski to take the floor on this ground.
There is a slight difference in approach, providing all the kinds of services to the older people and the people with disabilities. They have both groups the same needs in the relationship of the care of the body, of the mental health, but the people with disabilities, there is one additional thing, and that is their integration in labor market. They want to be part of the labor market. They want to be part of the society working. They want to earn their own money so that they could be self-independent or part self-independent or partly self-independent. And that's the only difference because the older people, they don't we don't deal with them like with the labor market, but all their needs, not only the body needs, the care needs are the same. And one thing is that we have to always keep in mind that these people, it's very important that they have some role in the society, that they have the meaningful life, that they see that they are here for someone, and that it's not just day after day after day, but they are important. They are an important part of the society, and this is a role that is very important for people with disabilities, for older people, for all the people, not only the one that are in need of long-term care provision. So that would be the only difference that we see there.
So maybe here, Sergio can tell us about the quality of care. Can it be measured? How? What is the state of the discussion on indicators for quality of care at European level, do you think?
Okay, just few reflections, few lines about the issues that have been arisen and just posed to me. Just on quality of care. What the new steps that we are doing, and right now the inspection service is starting a 360 degrees evaluation process of care for anyone being cared at home or anyone being cared at a nursing home or a care settlement. So that's the way of starting that process, and we need new standards that look at care, objective life satisfaction, subjective life satisfaction, and avoidance of non-desired institutionalization. Those are the three KPIs that we are using and we are deploying in the new services. Those three issues on care, but I think that this is one of the issues that EU-care strategy could help to deploy and to have common care evaluation systems at European level. Second point, and very quickly, on just to underline that involving informal carers, involving health care system with social care systems, and involving the communities, it's not only just more cost effective, but it's at the end delivers more happiness to people in need of care, but at the same time, it's more cost effective. We are looking into new specific new examples, and we are looking at this part of the issue. And the last but not the least, about disability and people in old age. There is a merging process of the approach in delivering care to both. As far as we are developing this new approach for care in people for age people, there is a convergence process in the care, the approach of care for both groups of people. So it's what I wanted to point out in this intervention.
Unfortunately, the time is coming to an end for this session without having a real discussion, but that goes to show how complex and how wide is the subject we have been tackling in such a short time. Of course, the participants, as I said, could put on additional questions and additional issues on chat, which will be looked at very carefully. And now we have to conclude, and there will be a coffee break from 11:30 to 11:45. Thank you very much for your attention, and thank you very much for all your participation and the very knowledgeable contributions. Thank you very much.
Thank you. Bye-bye.
Thank you very much. And we reconnect in 15 minutes.
Caroline. I may contact you by email. If you can email me, I will contact you and explain how it's working on the issue that you raised in the short debate that I couldn't understand. Answer. So, yeah,
Yes,
so.
yes, good. Yes, I thought your example was really very inspiring because we in healthcare, you know, we also wanted to see how we can get people out of the hospitals into the community, and I think for the future, it is the bridge between healthcare and social care. It's a bit of a gap now, and we need to find ways how we can make better use of each other, and we really have to totally reform, you know, these services. And I think that
it's not easy even here, but there is a real dialogue we have, and the long-term concept has helped us to feel comfortable within it. So we are working much more together now. So I think that we will share it by email, or if not, we can have a chat or a conference.
Yes, that would be super.
Let's keep in touch.
Yes.
Sure.
Okay.
Maciek and Anthony may exchange our emails in a short email. I will really appreciate. Maciek.
We will be sure, so everyone will stay actually connected. Thank you very much to both of you.
Thank you, and Maciek. Thank you, Anthony. Bye.
Thanks also, Caroline. Bye-bye. We stay in touch. Hello again, everyone. I can see that we've got already the speakers of the next panel that are actually joining us. So now I will ask our, yes, hello, Elena Weber, a member of Age Executive Committee from European Aging Network. So Elena, it's up to you. I hand over the moderation of this second panel of the first part of our conference. So please go ahead.
Thanks a lot, Maciek, for inviting me to be moderator today and for the floor now. And thanks to our speakers of this panel. I hope you can hear me properly. I'm not old, but I'm aged, and I'm not so happy with the technology, as
it's
Maciek
perfect.
probably knows. Thanks. This panel is dedicated to the analysis, we can say, of equity in care and to the way to ensure universal access to care. This is for sure an important topic in supporting older persons during all their lives. And the questions for this panel and for the speakers of the panel are connected to the opportunities the European Union and member states can, but probably and perhaps must set up to be able to make care available and affordable for all these, for all persons or older persons, we can say, throughout Europe and the European Union for sure. You listened before in the first panel discussion, different opinions in supporting care for services, quality services and quality in long-term care. And also there was my president of European Aging Network as a speaker. And of course, the first panel discussion was more detailed concerning the EU care strategy by the Commission. Now, this second panel would like to focus a little bit more if this support that we can give to older persons throughout Europe can be, as I told you before, accessible and affordable. For this discussion, for this exchange of opinion, we will have, I will introduce you all and then I will give the floor one to one, or each of you. Professor Agnieszka Klon-Dominczak, I hope my pronunciation is correct for all of you, Mr. Santiago Calvo Ramos, and then Mr. Stacy Igemonos and Dr. Nadezhda Todorovska, and last but not least, Dr. Liz Mesteneos. So I think that we can start from the first speaker, Professor Agnieszka Klon-Dominczak. And so, Mrs. Klon-Dominczak, the floor is yours.
Yes, thank you very much. Thank you very much for inviting me and the opportunity to present some of the thoughts and opinions that come both from the perspective of someone who deals with the demographic change and the demographic perspective, population aging, also both from the research side, as I'm a member of the international team working with the survey of health, aging and retirement in Europe, as well as my role, which is mentioned in the program as a member of the expert group on high-level expert group on the future of the welfare state. Indeed, as it is discussed, the issue of long-term care is one of the important challenges that is not only seen from the perspective of specific solutions, but also first and foremost, maybe not first and foremost, but because of the demographic change, this is a challenge that will be more and more acute in Europe. If we look at the projections of Eurostat, the number of people aged 75 years or more in Europe will increase from around 44 million in 2020 to more than 75 million by 2050. This is a scale that cannot be ignored, and that means that the population that requires not only old age transfers and supporting their consumption with the regular pension systems, but also other support, including healthcare and long-term care, is a huge challenge for virtually all member states. And this is also combined with the population aging trend, which also includes shrinking of the working age population or reduced the share of the working age population in the total population, and also reduced share of children in the total population. So that also means that the long-term care provision becomes important, and we of course observe challenges which are related to the fact that with increasing life expectancy, with more people in older ages, we observe more problems related to health situations such as mental health problems, dementia, Alzheimer's disease. So the kind of health conditions that definitely require long-term care solutions, either supporting that care in the household environment, in the family environment, supporting for carers, or indeed developing institutional care and supporting high quality institutional care that is needed to provide such care. In the work of the high level group, we point out not only to the let's say mega trends such as population aging that I have mentioned, changing world of work, which means that also we observe different kinds of changing not only conditions of work, but also contractual types of work, which mean that not all individuals are covered by the typical employment contract, which is related to the coverage of social insurance, which of course raises a question related to financing and right to various social insurance benefits, and providing long-term care by appropriate social insurance is one of the policy options that could be considered. And in such case, of course, the issue of adequate social protection coverage becomes important. There's also a digital change, and with regard to digital change, it is important to mention also the potential of the digital technology that can support and should support also long-term care solutions. So again, this is a mega trend that is important to consider and discuss when we think about long-term care provision. Finally, it is also important to mention that not only mega trends, but also current developments that we observe. And here I would like to refer to obviously the COVID pandemic is something that also changes the landscape and the shape of the needs for care that emerged during COVID. And here I would like to refer to some of the data that comes from the survey on health, aging and retirement in Europe, as in 2020 and 2021. There was a special telephone survey dedicated to COVID issues among the people 50 plus. And one of the questions that were asked during this the survey was indeed a need to either provide or receive the support, help outside own household. And what we observe is that indeed the need for support increased among the senior Europeans, but also among those 50 plus. The frequency of providing help to someone outside household increased quite significantly. So we see that depending on the region of Europe, especially in the Southern Europe, in Eastern Europe, more than 50% of people 50 plus that indicated that the frequency of providing support to their parents increased significantly, and also between between the 2021 and 2020, so with the development of COVID pandemic, again, especially in Eastern Europe and in the Baltic countries, the frequency of providing help to parents increased even more. So we do observe that the health development and the COVID pandemic, I think, made us realize how important it is to think about the long-term care provision and the stress to the long-term care systems that was seen. That also means that in the work of the high-level group and the future of social protection, long-term care for older adults and also for other people that require such a support is indeed raised. And of course, as our report will be concluded by the end of the year, I'm not able to provide any specific issues, but nevertheless, the question and the policy options related to developing stable long-term care systems that are part of public finance provision is one of the policy options that is definitely on the table, that is seen as important. Developing relevant quality standards that relate to long-term care within the public system, preventing various kinds of unexpected or unwanted behaviors with relation to provision of care and the way the care services are provided. These are definitely the issues that are important for the future of the welfare state in Europe. Thank you very much.
Thanks to Professor Agnieszka Klon-Dominczak. Since I forgot to introduce her, she introduced, of course, herself by herself, and I'm really sorry for this. She's a member of the EU high-level group on the future of social protection and of a welfare state in the European Union. But specifically, she is a professor, associate professor at the Warsaw School of Economics, and lead the work of Poland Insure Survey. But especially we would like to hear, next year we can understand the final version of this report of the high-level group, because for sure it will bring us some important information about the subject of this panel discussion. And in the meantime, Professor Agnieszka Klon-Dominczak was speaking. Mr. Santiago Calvo Ramos was nodding and when she was speaking specifically concerning the public financing of the long-term care system. Now I will try my best. Mr. Ramos is a policy analyst for sustainability of public finances in the Commission Directorate General for Economic and Financial Affairs. So definitely the point of the European Union and of the European Commission on the way to maintain or to make the long-term care system affordable and accessible to all older persons is, I'm pretty sure, part of his speech for today. Thanks, Mr. Ramos.
Thank you very much. Yeah, so I work in Unit C2 of DG ECFIN, and our work is we try to assess the long-term fiscal sustainability of European health and long-term care systems. And also we try to see how they could become more efficient. And every 3 years, we work with the Aging Working Group of the Economic Policy Committee of the European Council to produce the Aging Report, which is basically a publication that has long-term expenditure projections up to around 50 years for age-related expenditure items. So this includes things like pensions, it includes things like healthcare, and of course, long-term care. Now, as Professor Klondominchak has just explained, over the next 50 years, we expect a great deal of aging in the EU. With the total population shrinking, but the working population shrinking by even more. And this means that we expect increased demand for long-term care, as we will have a greater proportion of the population that will be elderly. And the estimated number of people with care needs will basically almost double, going from around 4.5 million estimated now to around 7 million by 2070. At the same time, we expect that there will be other drivers of expenditure that will not be demographic. So, for example, as countries become richer, it's likely that they will want to develop the long-term care systems further, that there will be more public demand for long-term care systems. There's a great diversity in European long-term care systems. You have pretty much comprehensive systems in some member states, typically in the north of Europe, and you have on the other extreme, some countries that actually pretty much do not have a system and just provide help to the most dependent people, and the rest is dealt with through informal carers. So we have a huge diversity, and this aging is going to basically increase the convergence in both systems, whereas countries that currently don't have long-term care systems will want to have long-term care systems in the future. At the same time, the supply of informal care is likely to become more restricted in the future due to changes in societal norms, increased female labor participation, labor mobility. People will not necessarily live in the same town as their elderly relatives, and so will not necessarily be able to provide them with care. So we have basically an increase in demand and a decrease in supply. So because of all of these factors, we expect that public expenditure, so the taxpayer, expenditure on long-term care will need to increase from around 1.7% of GDP on average for the EU at the moment to around 2.5% in 2070. Now, this is a very conservative scenario, and our risk scenario, which includes a greater degree of convergence between member states in terms of the long-term care that they provide, expenditure would be up to 4.8% of GDP by 2070. So the potential for growth is enormous. And of course, we know that many member states have high levels of debt already and may have difficulties in funding this increase in expenditure. So what can be done then? One option would be to leave it to the market to supply. But of course, long-term care is very much like healthcare. There are several market failures that mean that if we just leave it to the private sector, the supply of care will be insufficient and will not be appropriate. And so there's a very good case for having public intervention, while at the same time dealing with the fiscal constraints that we have. So basically, our suggestion is to improve the cost effectiveness of long-term care systems for the countries that already have very evolved long-term care systems, and for those that don't, to actually ensure that as their long-term care systems grow in response to the increasing demand from the population, from the dependent population, et cetera, and become ideally universal, that they set them up in such a way that the cost effectiveness is guaranteed. And so I'm thinking about things like ensuring good governance. Governance of long-term care is typically incredibly fragmented. So it's not atypical that the cash benefits are organized by the Ministry of Social Affairs, institutional care is organized by the regional government, and home care is organized by the municipality. It depends according to member states, but it tends to be very, very fragmented. And these different levels of government don't always share data. and don't always know that the person that they're providing cash benefits to is the same person that is receiving home care or institutional care. And most member states cannot say what is the total number of people they cover in terms of long-term care, and cannot say either how much they spend. I mean, the majority of EU member states can, but there's a large majority that cannot. So there's a huge problem of data, basically, and a huge problem of governance, because once you have the data, you have to arrange it so that all of these systems together can provide person-centered care, because the person doesn't care that needs long-term care, doesn't care about the 3 levels of government. That's not their problem. What they need is to receive appropriate care for the level of need. And so this is something that needs to be sorted out at government level. At the same time, there needs to be sufficient and stable financing. So it's necessary that the systems are well funded, otherwise they will not be able to provide care in a continuous way over time. The appropriate care setting should be used for each level of need. So, of course, home care is an incredibly important setting, but for people with high levels of need, institutional care should be better. Cash benefits may be extremely useful for people that are young and disabled, and therefore would like flexibility in how they arrange their care. It depends, on the context and the needs of the person, and ensuring that each person gets the right type of care that they need at the right time is very, very important, and also can make the system more cost effective. Then it's important to actually benchmark the performance on quality and efficiency of care. It's something that I could see in the questions to Sergio from the Biscay government earlier on. And yeah, it's basically, you'll never know how well you're performing unless you can compare with how others are doing it. And for that, we need, again, data, we need indicators, we need sharing, and we need governance structures that actually reward good performance, but also look for the causes of bad performance and try to fix it. Then for member states where the funding for one reason or another will be limited, it's very important to prioritize the expenditure appropriately. So to focus on those who need care the most and can least afford to pay it. I mean, ideally, we want every country to have universal long-term care, but in the meantime, that can be a good way of spending money in the most efficient way. Then workforce is a huge issue, and member states should use the different tools they have to ensure that there's the appropriate workforce to look after people with dependency needs. And there's many different levers that they can use, and they should ensure that they use them so that the appropriate level of care is given. Again, the needs of member states here are very different depending on how big their system is, but they all need to look after the workforce. That's very important. And finally, it's very important as well to support family carers, because even in the most comprehensive systems and universal systems we have in the EU, family carers play a super important role. And so having policies to actually support them, while not discouraging the labor market participation, etc., but it's really, really important, because they are really an important part of the system. So yeah, so just to sum up, as our population ages, we will have greater demand for long-term care, and we need to find ways of making this care efficient so that we can continue giving it in the future, and that this can be provided well into the next 50 years. So thank you very much.
Thanks to you, Mr. Ramos. Thanks because you point out 2 important thoughts or subjects, because some also in the chat point them out. That's data and the relationship with the governance. And data is a very important issue, and there are not so many data around Europe concerning long-term care, but also data concerning people with special needs or with disabilities or older persons with polypathologies. And it's definitely something I'm working on, because if you suggest us to sum up that there will be a greater demand for long-term care throughout Europe in the next years, and that demographic change, Professor Klon Domichak was telling us for sure will not shortage it. in the next years. Definitely having some data can let or support us understanding which can be the best future or the better future, if not the best, that we can offer our older persons. So when we will be older persons and needs to long-term care. And definitely you analyze in a precise way the importance of governance, and for sure the governance, as you told us, in the sector of long-term care is very much divided or fragmented, and this is difficult to sum up in a univocal way, also because countries are different and cultures are different inside countries. I can tell you that in Italy, I'm from Italy, also in different regions, there are different cultures concerning long-term care. It's not only a matter of differences between countries. Thanks again. There will be, I hope, some space at the end for some questions. Next speaker is Stacy Igemonos. She is director of Eurocareers, that's the European network representing informal careers. And so, Mr. Igemonos, the floor is yours.
Thank you, Ms. Weber. Good morning, everyone. And first of all, let me say I'm delighted to be part of this conversation. And so I'd like to thank colleagues from Age Platform Europe for their invitation. So yes, I work for an organization called Eurocarers. Our mission is essentially to be the voice of informal carers, also known as family or unpaid carers, depending on where you are located, but essentially people, relatives, friends, neighbors who provide usually unpaid care to someone with a chronic disease, a disability, or any other long-lasting care needs. So when it comes to the way we see the situation of long-term care systems in Europe today, and within these systems, the role and the situation or the needs of informal carers, I would say this. On one side, as we just heard earlier today, we all know about the challenges related to demographic aging, the growing prevalence of chronic conditions, the growing demand for care, but also as a result, the questions relating to the sustainability and quality of our care services, and also about the structural challenges facing the long-term care sector. We also heard about that earlier, by colleagues from EAN, for example, with staff shortages, poor job quality, inadequate skills. So from our perspective, when it comes to professional care, very clearly, it is extremely urgent to address these challenges. It should be a priority, particularly if we want to preserve the principles of universality and equality of access to care in Europe. And this also relates to the need for social investment, which was mentioned by Ms. Pereira this morning. So I'm not going to delve into that in my intervention this morning. On the other side, and obviously that's my core expertise today, I want to speak about the situation and the role of informal carers. And the reality is that it is informal carers, and women in particular, who currently provide the lion's share of all care in Europe. And the economic value of this unpaid care is actually so big that it is simply impossible to replace by professional care. According to Commission's estimates, the value of informal care, the contribution of informal carers to society, amounts to between 2.4 and 2.7% of the EU GDP on average, which is way more than the budget currently devoted by member states to professional long-term care. That amounts on average to 1.7% of the EU GDP. So economically speaking, informal care is just essential and impossible to replace, as I said, at least not in the foreseeable future. And of course, we could stop here and decide, okay, the status quo works fine, and we should maintain that situation. After all, it looks easy and convenient. We can rely on informal carers, as I said, relatives, friends, neighbors. after all, it is a cheap or I guess even a free workforce, but obviously there are additional problems attached to the phenomenon of informal care, because when informal carers are not adequately supported, they tend to struggle to access education, employment. They may fall into poverty as a result of their caregiving. They face social exclusion. Many also face health issues, so both mental and physical health issues as a result of their caregiving. So it is really a vicious circle, and I should add that the majority of informal carers actually do not necessarily choose to get involved in caregiving. They simply had no alternative. And so caregiving is very often imposed on people and on women in particular. So what my organization has been saying for pretty much the last 15 years is the following. First of all, professional care and informal care should be approached as two sides of the same coin and not as mutually exclusive forms of care. We need to invest in both professional and informal care. This was mentioned by Mr. Murillo. It was just mentioned again by my predecessor. The two go hand in hand. The second thing is informal carers have been invisible for too long. So they must be brought out of the shadows. The central role they play, the central contribution they provide, and the impact of that contribution on their life should be recognized. They should have the right to access support in the form of information, training, work-life balance solutions, respite care, financial support, social protection, and so on. And last but not least, of course, choice should be guaranteed. So in other words, people should be able to decide, and by the way, when I say people, it's all of us, we should be able to decide whether or not we want to be carers and to what extent we want to be involved in the provision of care. Now, in this context and in our view, an ambitious EU care strategy simply could not ignore these aspects. And I must say that all in all, we are very, very pleased with the package put forward by the Commission. We believe that it holds great potential for the next steps of our work and movement. For many reasons, which probably I'm not going to be able to detail this morning, but I'd like to give you just a few examples. First of all, the strategy, for the first time ever, at least at EU level, explicitly acknowledges that professional care and informal care go hand in hand, as I said before. This is a major step forward because what the Commission is essentially saying with the strategy is that both formal and informal care are important, but informal care should supplement professional care, not the other way around, as is the case in many countries at this stage. So the key challenge for us, all of us in the future, I suppose, will be to accompany the implementation of the strategy and inform member states as they, or public authorities at whatever level, as they try and define what is an acceptable balance between professional and informal care. So the shared care that Mr. Murillo was talking about earlier, what does it mean in practical terms? You know, in what proportion do we need each of the two forms of care in the design of future care systems? The strategy also calls on member states to establish clear procedures to identify informal carers and to support them by reinforcing the collaboration between care professionals and informal carers, by providing access to training, to counseling, to healthcare, psychological support, respite care, as well as adequate financial support. So as you can see, the Commission has been extremely comprehensive in its approach to informal care, and so we are very pleased of that. As a matter of fact, the Commission goes so far as to suggest the possibility of formalizing informal care via service contracts with public authorities in some specific cases. which we believe is not only a bold, but also a very welcome proposal. Now, obviously, nothing is ever perfect, and there are a few elements in the strategy which we see as slightly disappointing or questionable. For instance, the strategy tends to focus almost exclusively on working carers, on informal carers of working age, or on informal care as a barrier to a so-called productive life. Older informal carers are barely mentioned. Young carers are not mentioned at all. And we believe that this is a missed opportunity because in previous initiatives, the Commission had demonstrated a much more inclusive approach. And of course, in informal care is much more than an obstacle to something else. And all carers, of course, need support, regardless of their age or employment potential. Social protection, and in particular, the idea of taking into consideration the time spent caring in the calculation of pension credits, which was mentioned by Commissioner Schmidt at various occasions in the run-up to the publication of the strategy, is only mentioned very briefly in one of the staff working documents in the package. Once again, we think this is a missed opportunity because access to pension rights was in the top 3 of measures requested by carers in the Eurobarometer survey conducted by the Commission on the topic a few years ago. And also it would definitely help to address gender inequalities and in particular the gender pension gap. But as I said, all in all, we can definitely live with the content of the strategy in its current form. So I really want to leave you on a positive note here. We believe that once endorsed by the Council in the coming weeks, the strategy will provide a very good blueprint to inform the development of more carer-friendly policy environments across the EU. And we even believe even beyond that, because we can see how neighboring countries are already getting inspired by the ideas contained in the strategy. So I'll leave it at this for now, but of course I'm happy to and look forward to your questions in the discussion afterwards. Thank you.
Thanks, Stacy, for your interesting approach. And definitely the 2 ways of supporting care inside our long-term care systems are working the same or at the same level, both for the better lives of our older persons. And one for me interesting matter is training for informal careers, because no one is taking care of their this matter, and this is important for them for sure, but also for older persons, because in the last years, 20 years, something changed, and it is important for them to know about it and to use this new way of supporting persons also at home. I think Professor Klon Dominchak was saying that, of course, there are different ways of supporting, and home-based services must not be the only one, as long-term care services in institutionalized, sorry for this word, it's difficult for me also in Italian, and it's working the same, so we must take care of all, and the choice of being or not being informal care is an important matter, because of course this is all a system, and if there are not enough institutionalized services, probably the choice about informal care is not a choice, probably. Thanks. We will have time, I hope, for some open discussion. Next one is Dr. Nadesha Dorowska. Sorry.
Thank you. Everything is okay.
Okay, thanks a lot. She is a Deputy Director General for Age Member in Bulgarian Red Cross. And she's also a medical doctor and holds a PhD in finance. And we hope that sometimes in some places she will explain to us the connection between the two. And I will leave to her the floor, speaking about the development of also home care services in Bulgaria and the health connected with the health promotion and the prevention. Thanks.
Thank you very much, Mrs. Weber. Thank you very much, H Platform, dear colleagues and friends. Thank you for the opportunity to share with you this information from Bulgaria. But first of all, I would like to share my screen for the presentation. I hope you can see it now. Just a
Yes.
second. I shall try to. No. Okay, maybe I cannot change this to have the full screen now for this presentation, but
Nadezhda, if you go down to your screen, you will see you have as a little sign that shows a screen. If you click on it, we will have a full screen presentation. So down.
Okay.
And yeah, on the last ribbon nearby the focus. Yeah, this is it.
Yes. Now it's okay. I hope everything is okay. Thank you very much that I can for the opportunity to introduce our innovative community care models in favor of people with chronic disease and disabilities in Bulgaria. Especially, we offer this type of services in the poorest region in Bulgaria. Unfortunately, not only in Bulgaria, but also in the European Union. This is Northwest Bulgaria. We have a lot of challenges, but main of them is that we have an equal distribution of healthcare facilities, medical professionals, and services across the country. This means, of course, we have difficult access to healthcare services for vulnerable population groups. Unfortunately, older people, they are one of the most vulnerable. I would like to mention that the minimum pension of the one person here in Bulgaria is 370 leva, which means 185 euro per month, which is really, really very low income. Poorly developed pre-hospital care and lack of coordination.
Excuse me, I think we don't see the slideshow, and we see the first slide at the moment.
Main challenges, did you see these main challenges or not? No?
No, Nadezhda, you please, you have to actually click maybe because we are still on the first slide. So,
okay. Because on my screen is everything okay. Maybe I.
Maybe you shared only the application PowerPoint rather than your whole screen.
Just a second. I shall try again to do this. Did you see now?
Yes.
Yes. Perfect.
And okay. We have poorly developed pre-hospital care and lack of coordination. We have, unfortunately, high share of hospital care, and it cost is 66% of the cost of the health system in Bulgaria, which is, you see, a lot. We have highest proportion of hospitalization in the EU for chronic diseases, almost twice the EU average. More than 20% of hospitalization can be routinely treated on a outpatient basis according to international standards. 46.6% is in Bulgaria the direct payments from the patients, which is again the highest level in the EU. A reduction of the number of potential caregivers due to a decrease in the working age population and increased migration processes. We have a lot of nurses and home helpers, but unfortunately they are working somewhere in Europe, not in Bulgaria. That's why we have to try to see how we can manage the situation here to cover the needs of older people. because the health status of older people is also not so good at the same time. Older people and marginalized communities and population in small and remote settlements are most affected by the lack of medical care. An increasing trend in chronic non-communicable diseases causing death and reduced working capacity. About 2/5 of the life after age 65 proceed with several accompanying health problems on permanent disease or permanent disabilities. Over 1/2 of the people over the age of 65 have at least one chronic disease. Almost 1/4 of the population 65 has an identified disability that limits basic activities such as dressing, personal hygiene, etc. Cardiovascular diseases is the leading cause of death in the country. And of course, at the end, we have highest mortality rate in the EU. At the same time, Bulgarian Red Cross, together with different stakeholders, we push a little bit our system here in Bulgaria to organize better legal framework when we are talking about integrated medical social services, and especially at home. Now, since 2019, we have regulated social services, regulated medical social services in our law for social services in Bulgaria. We have also approved the national strategy on long-term care, and there these medical social services they are included. Since 2019, we have also license regime, which is very, very important because when we are talking about people and services, we have to think also about the quality of services. And this license regime and national quality standards give the opportunity to the state agency of quality of the services to check all providers in Bulgaria who wants to give to the older people or other types of services support on local level. Funding available through EU funds, including for teleassistance and telecare services. As a Red Cross, we have started to thinking about older people and their needs since many, many years. And since 2002, we are a provider of home care services here in Bulgaria. We organize also the first training for home helpers, for nurses for their work at home of the patients. And at the same time, we started our advocacy work for the rights of older people. And we became a member of Age platform. I think it was in 2009. We started with our activities in Northwest Bulgaria in 2012, using the Swiss model for home care. This means hospital at home, Spitex at hospital at home. We have medical nurses, we have home helpers, but the patients with chronic disease and disability, they stay at their own homes, which was very new for Bulgaria. At the moment, we have upgrade our home care model with innovative approaches. We use new technologies, and at the moment we have these innovative community care models in favor of all people with chronic disease and disabilities project. Organizing this project together jointly with Ministry of Health, Ministry of Labor and Social Policy, and the Norwegian Association of Local and Regional Authorities, COES, funded by the EEA financial mechanism. And the main task is this introduction of teleassistance and telecare services for older people. What means this home care model? maybe for most of you, this is clear. But new in this situation is this control and communication center, where we have this absolutely important connection with our patients, with our beneficiaries, and with our staff in the home care centers, plus other stakeholders in one municipality. What we have now in Northwest Bulgaria? We have in 3 regions, Bratsa, Vidin, and Montana, 7 home care centers. Our professional staff, we have 25 nurses and 45 home helpers. Total number of beneficiaries served are 700 persons. Home care upgrade with teleassistance and telecare services, and we have call center where we cover 500 older persons, 50 plus, with chronic diseases and permanent disabilities. These older people, maybe some of them, they are following active treatment in hospital, and 35% of them, they're living alone in small and remote settlements. What is important here? At the beginning, we started with home care centers. One home care center offer medical service and social support. This is nothing new for you, but what is important is this specific medical manipulation suitable for outpatient settings, and teaching the beneficiary and or his relatives in self-help. Just before me, Stacy already spoke about informal care. We see this possibility to train this informal carer using the capacity of home care centers and our team there, because they are the both side of one coin, and we try to join our efforts to do something more for our older persons at their homes. Teleassistance and telecare services, we have 24 hours remote monitoring of the health and social status of people with chronic diseases and disabilities. We already organized this communication center in one of the towns in this region in Bratsa. This center covered the whole 7 home care centers and our beneficiaries there. We integrated these services with the activities of the home care centers and train our teams to work with the software and the personal devices in beneficiaries' homes. As I mentioned already, we cover 500 people in this region. Main functionalities of these devices. We have 2 types of devices. First type, this is one bracelet. We measure pulse, heart rate, saturation, stress level, activity, reminder for medication intake on other events. And we have second one type of devices, which is more medical oriented. We can measure temperature, blood pressure, ECG, body position, sleep monitoring, panic button, etc. In our system, we can add different devices, and I hope in the near future we can have this opportunity to upgrade this monitoring with new devices to give more information for us and for the patient and their relatives for their medical and social conditions. At the same time, our home care teams, they are working on the field. What they have to do, to assess the need of tele-assistance and telecare services, to install the devices at the beneficiary's home, to provide training to the beneficiary about the functioning of the devices, including safety rules, to administer initial information in the software after installing the device, personal data, diagnosis, family doctors, etc., to react in case of emergency or registered determination of psychological indicators within their working time, because they are working not 24 hours like the call center. Next steps, of course, to elaborate response protocols, because this is for this type of reaction using call center together with home care centers and other stakeholders on local level, everyone municipality, is not so easy at the beginning. That's why we are have now using our experience in the last year, we should organize these response protocols jointly with Ministry of Health and Ministry of Labor and Social Policy, to establish a system of communication and coordination with relevant healthcare and social services providers at local level, for example, emergency aid, hospitals, etc., to perform an assessment of the overall process of introduction of teleassistance and telecare services in Bulgaria, jointly with the Western University of Applied Science in Bergen, to elaborate draft proposals for legislative regulation and standards for teleassistance and telecare services, and to upgrade the model with telehealth, including establishing a system of communication and coordination with GPs, hospital, and other medical specialists. I'm speaking about new technologies, and I fully I'm aware about the problems for everyone, older person who has to be informed about new technologies, about devices, etc. You know that the one person in this age has a lot of stress when have to work with these new technologies and new devices, and we need to slowly to support them in this way to organize their normal life with these devices together. Thank you for your attention, and I'll be happy to answer if you have any questions. Thank you.
Thanks, Dr. Todorovska, for your presentation. It is very interesting, the subject that you focus on, also because, in my opinion, it is a crossing or taking care, and sorry for joke of words, both social innovation and ICT innovation, that normally technology goes on one side and the social inclusion and innovation on the other side. Instead, in this presentation and the project that you are exploiting as a Red Cross, the two things are merging in a propositive and positive way for older persons. And for sure, we will be interested to understand what is going on and if effectively older persons are using them, probably supporting some nephews and nieces that are definitely more technological than them, and how the project is working in the future. Thanks a lot again. And
just I would like to mention only this, that we have a lot of older people, they're living alone at their homes. And that's why we need very well trained staff in our home care centers to motivate them, to explain them, and to coordinate and control all these devices if they are working okay or not well. That's why it's important to know that, okay, new technologies is, I fully support these new technologies approaches, because without this we cannot manage the situation with so many older person and needs, and from one side, and less workers forces from other side. But First of all, it's important to organize this home care model with real people on the place, on the field, and then we upgrade with these new technologies. In most of the cases, we see the different approaches. First comes the technology, and then after the button, who will react is the question. That's why, as a Bulgarian Red Cross, when we started from the position to make a good basic with our home care models, and then to upgrade it with new technologies. Thank you once again.
Thanks again. And an important matter, and we go back to what Stacy told us, is the training, because these people, real people, you said, the physical people, concrete people,
it's not easy.
Trained to support, yes, all the persons at home. And again, training both for professional as well as for informal carers, it is definitely very important. And last but not least, as I told at the beginning, there is a doctor, Mrs. Liz Mesteronos. She is a member of the board, one of the co-founder of 50 Plus Hellas, a Greek organization raising older persons, older people's voice and age, member, of course, in Greece. And she's also a sociologist and a researcher, a member of the Hellenic Association of the Gerontology and Geriatrics. And she was, thanks for doing it, former Age Platform Europe Vice President. Mrs. Mesteonos, the floor is yours.
Thank you very much for the invitation. And I have to give some very hard truths. I've been working on this subject. I think this is why I don't like older people sometimes. We've been around too long. I have been working with my friend Judy Triantafilo on caring and the issue of family care. 1989, when it was funded by the European Foundation at Dublin. We then did a big study, the Eurofam Care, which was actually one of the major supporters of the foundation of Eurocarers. And more recently, we got back into it slowly. The World Bank was asked to do a study to make proposals to the Greek government so that the Greek government could get funding from the EU to actually fund better long-term care services. I'll go into that in a moment. And we were doing some of the practical research with a company. They did it. And what came out of that, and I suppose I want to underline this, is the political will. I have not seen a huge amount of political will, and I am delighted to hear from the EU that it's moving forward. It sometimes feels like a snail's pace, given the actual dimensions of the issue, but never mind, it's moving forward, and thank you for that. It's always glad to get some messages forward. What we came out is we haven't had the final report from the World Bank, or rather from the Greek government. And what we think is that they're proposing for a mixture of very limited public, but mainly private market and NGO solutions for the issue of paid, or rather remunerated services. And that isn't where we are. I mean, we are all in a situation of, and the Bulgarians was interesting, but we all get into different situations of looking at the numbers of people needing care and what kind of care. There is a lot of research on it. I'm not going to go into this, but I'm just going to start off by talking about Greece, because I don't think it's irrelevant to many other countries. Public services, public resources are not really made very available for long-term care. There's not enough in many, many countries. Let me take the home care. I think Mr. Ramos talked about the extremes of care in some countries, and we're one of the extremes. Home care services do exist. They are available at local authority level, but they are limited. They're available only more or less to people on very low income, who have no or very limited family care available, and who need help with ADL and IADL. So they're there, they are valuable, but they're just not really available for not an expanding group of people who still need it and who are alone and need that care. Residential care, we've got approximately, we don't really know, more homes have opened, but still, given the aging of the population and particularly fast increase, it's still probably about 1% of older people who go into them. And of course, the people who go into residential care in this situation where they're expensive very often, I'll come back to the cheap ones in a moment, but they are expensive for people on a fixed budget, which is what pensions are, is that they're very often dependents with diseases that informal carers can't cope with anymore. Think about people with aggressive forms of Alzheimer, or, there are things with Parkinson's, where the people can no longer cope at home with looking after the people. They need professional care, and that people can't cope at home. And that's what happens, is that actually residential homes often have the most disabled inside their residences. We don't have much of it. There are a few, but we don't have people who choose to go into residential care just for having to get sort of rid of just feeling old and wanting to be looked after. That doesn't really happen. I think most of them are being used for people who really need care. We do have some cheap unregistered homes. Nobody knows how many. They come and go. They are sued, they are prosecuted, they change their name. Nobody knows really what's going on, and people can't keep up with them. But that happens as well, because people have such a low income in some cases, better than the Bulgarians, but still it's not enough to pay for a decent residential home. Everywhere, paid carers, paid, whether they're nurses or care workers, aides of all kinds, and even if we talk about the good residential homes, they're very difficult to find. And so what you're finding is that now private homes are recruiting for nurses to come to Greece to work. Now, we could not imagine that would happen because we have high rates of unemployment. But no, that's not what people want to do as a job. It doesn't have prestige, and it doesn't have a good salary. So people are recruiting, the owners of homes are having to recruit abroad. And it's in a sense paralleled by what goes on amongst informal carers. Those who are wealthy recruit privately carers into their home. Bandati in Italian, but they're informal foreign carers. And they may be from some of the European countries, and they may not be, but a lot of them are from much further abroad. Families in general do the majority of the care work. And as I said, be careful. When it gets extremely dependent, families may try to find the money to get their person cared for professionally. But so they're kind of figured to do most of the care, 80% women, but, and I warn the men sitting here listening, smaller families, greater longevity, migration is leading to more spouse care. So the men end up caring for their disabled wives often. And of course, a lot more men informal carers when they're the only ones left who can care. And so I just say, we say this about women, but actually it's going to hit men more and more. So we might find some interesting solutions too, but not amongst necessarily well-off politicians. I did show a table. I don't think it's absolutely essential, but because I think people do know. I didn't load it myself. I don't know if I was supposed to, but it doesn't really matter. The actual effects of family care on people's health and on their well-being, on their capacity to work, is extremely well known. There's a lot of data on it. I have it for Greece. If you really wanted me, I'd upload it, but I'm not going to, because I think at this point, you probably just need to relax and listen. But you don't think I would lie about it. It affects people's mental health, economic health, physical health. And so we have to worry about this, because there is actually rather little state support to family carers. Thank you. Somebody's listening to me. Thank you. So I thought that I didn't want to blind you with data, but I just thought it's really worthwhile having a look at how much older carers are, and carers in general. By the way, the data, if you look at it, is very indicative. It goes from 18 to 64. Now they get 65 onwards, and that's quite a lot of carers are not included in this data. So they're not in employment because they're caring. They're not in employment because they've got a pension, but they are also part of the labour force. Far part of the informal carers working to look after older people. And the longer we're living, and the life expectancy is still increasing, then the carers are likely to be always that bit older. So I don't have any illusion about the fact that it will happen to very many people, that they will end up as being carers. I just left you with that, but I will go on and ignore that for the moment. So we know that unemployment amongst people aged 50 to 65 is extremely high amongst women. And at least it's not the only explanation, but it's certainly one of the explanations, is that many of them are involved in informal family care, whether it's grandchildren or older people, and that sort of impinges. And if they're on lower wages, in a sense, it becomes worthwhile them not staying in the labour market and going out and actually doing the care. It's not that they can't, it's just that there's no choice about it, because they're not low enough income to actually get support from the state services, the local authority services for help at home. And of course, other people have talked about the implications this will have for this generation of family carers. However, families know that this is the case, certainly in Greece. They know that this is going to happen from their parents. It's not that it comes as a total surprise. So for the better off, they can find usually some kinds of resources to pay for care if the worst comes to the worst, and do that. It will eat their savings, but they will do it. And of course, many of these people are, in fact, again, foreign care workers. So it's not happening only in residential homes. And of course, this worldwide absence of carers and public and private and adequate public or private services remains a huge issue here. And I'm going to say this, and I don't think anybody here is going to contradict me. They can if you dare, but migratory care workers are going to be what is a perfect solution. Okay, so nobody wants to admit it, but it's going to be there, and it's going to be the only solution. However, let me point out, many Europeans of the EU are actually also part of that labour force. If you ask Luxembourg where their workforce comes, it comes over the borders from France and Belgium. If you ask the British, they're getting Greek. I know some Greek carers who go and do temporary care work to pace other people. This is happening. The Romanians are famous in Italy, certainly for care work. So have a look at it. There's a lot of care work going on, sometimes very registered, permanent, sometimes less so. What we have then is limited public daycare, which is helpful for those people who cannot cope and have a day job. So we have some, and that's positive, but rather limited. We have no respite care, except to sort of sometimes they use the sort of cheap holidays allowable to older people as a way of allowing older people and their carers to get a holiday in the summer. But it's not really what you would call respite care, meaning by that an available service that allows people who are feeling stressed to be able to use that service in good conscience. I mean, you can go and pay somebody to do that and go into a home or pay somebody, but it is not always the best quality care. So people are reluctant to do that. There are no subsidies in Greece for those people needing care, nor any stipend or acknowledgement to family carers of any note. And we had the discussion earlier. The reality is that generations change, what people want changes. And this generation of older people often have as their central focus the family, and they kind of just hope that the family will cope, even when it can't, even when it struggles to do so. Governments then take this up as a sort of way of getting around the issue of providing decent care. They feel it's the families really want care. The older person really wants this care. Yes, they do. But actually, family carers are not really always able to fulfill their own lives and the adequacy of care needed by just doing it all privately. I am delighted to hear from Bulgaria that they're using supportive technologies for carers. I think we are about to go into that, and I'm going to talk about it in a moment. But we're beginning to get it into state, is it COVID-19? But it certainly isn't integrated in between in the health sector, I would say. And this, of course, and if you then begin to talk about, do people take notice of what family carers know about the person they care for in hospitals or in residential cares, I have my doubts about it. However, I have a positive story because I get lots of negative ones at the beginning. Actually, Greek residential institutions from the beginning had very low rates of infection of COVID in Greece. They cared about their people. So they worked across, whether it was the public or the private sector. As I said, they're no public. They're all not for profit or philanthropic or for profit. The rate of infection was very low. So when people keep talking about the profit motive may be thought of as people who actually know what they're doing and try to make sure people did not catch ill by doing the right things at the right time. And they worked across the public sector to make sure that they got the support they needed to protect the people in residential homes. And they did actually use ICT to overcome the awful isolation that happened in many residential homes. I think we got a big stimulus for using ICT amongst families and older people was COVID. We don't have the actual hard figures because nobody ever gathered them. But the number of people now using smartphones and tablets has hugely increased, and I'm waiting for the data. And although it is a way of people keeping in touch, it's very much an interpersonal mechanism as well as a distant mechanism. It's not just for monitoring, but it is this way of kind of families some caring remotely, also as ever, the poor, the isolated, the most isolated suffered the most by postponed medical visits, by not actually being able to use the digital technologies, and by social isolation. No surprise there. I suppose with time it will reduce, but one should be aware that some people will always be in that situation of actually no longer being able to quite use this technology. And that means that you will always need more things. Now, I am going to actually stop in a way, and because somebody's listening to me, and I thought you'd like to know what we're doing here, because we're a small organization and we got funding from something called TEMA Foundation. And we're just about to start because of this issue of training. How do you train people who come to family care for the first time? Sometimes reluctantly. They don't want to do it. They don't know. Some people are very bright and are going to figure it out. Some people are not. I have absolutely no idea about how you lift a very heavy person. How do you get them in and out of beds? I don't really know. And we thought that there's a whole lot of videos and material out there that maybe you are familiar with, or maybe you're not. But if you are familiar, we are actually planning to run a platform, importantly carers, and Stacey will be glad of that, to see if it works, to not just for psychological support, but very practical visual material, which doesn't need a lot of language. So that's why I'm here and asking all of you, if you are aware of video material that could be useful to people doing family care, we will find our Greek NGO I'm not worried about that. Countries may be aware of this material. And then we can help WHO with their training and seeing how we can show how that works or doesn't work. We don't know if it will work. It's worth the experiment to see if it does. I've left my email somewhere on the last slide. I've only put 2 slides up, so you can find me. I think I wrote it on the comments chat at some point. But if you can contact me, I would be very grateful. My name is unique, pretty well. So you can find me even, I'm pretty well available. I am going to be very delighted if you can send me links to any material you have. Thank you for inviting me. It's a sob story in a way, but there's hope that even the Greek government is moving on this one, and we may have better long-term care in the future. Thank you.
Thanks a lot, Mrs. Mestenos, for pointing out the services Greek, but especially your organization is producing or offering to your members and to people, all the persons in Greece. And when you asked if someone was listening to you, definitely we were. So don't be afraid for that. And also, I think that you went back to something Stacy told us, but also the other speakers about training, because this is an important matter. And I will repeat it more than once, also in a different kind of way of offering services. I mean, for professional as well as for informal careers. And again, family care is a duty, seems to be a duty, and sometimes it is, but perhaps we can have different opportunities to work for the future. We could have a lot of questions. I would like to point out one, and really we have, all of you have something less than 1 minute to reply. What if we are able at the European level to find a way to increase the prevention of health condition and the promotion of better health conditions as a way to if not reduce, but to differentiate the gravity of the weight of long-term care inside the European Union countries? Could be this a solution? I go back to Professor Klon Dominchak. The first, I will be very fast. Don't be afraid, Mr. Maciek, that is watching to us for 1:15. Please, Professor Klon Dominchak.
Yes, I believe it is very important to invest in health, and I think friendly health conditions, encouraging physical exercise, good diet, and also working your brain through solving different kinds of puzzles. This is something that definitely works and helps, and creating environment for especially senior citizens to meet together, maybe to discuss those cross puzzles together, is definitely something that could be a solution. I also wanted to use my 1 minute to just mention that SHARE survey indeed looks at the electronic contact between people during the COVID pandemic, and among people 80 plus in Europe, almost 60% declared that every day or a couple of times a week they had electronic contact with their children, which means that we do have data on that, and this is very encouraging that even people 80 plus are in frequent contact using electronic channels. So at every age we can learn something, and this is very important.
Thanks a lot, Professor Klon Dominchak. I'm going to Mr. Ramos. He was nodding again, so probably we got 1 point on prevention and promotion of health conditions.
Yeah, absolutely, absolutely. Prevention and public health measures to improve both the health condition and to reduce the dependency of people who are elderly or disabled is very, very important. In our model, in the agent report model, we actually have a scenario where we see what would happen if every year every year of life expectancy gained over the next 50 years would be spent without disability. And yeah, the reduction in terms of expenditure is sizable. And things like prevention, they're typically underinvested in because you see the fruits in the long run beyond the political cycle. And so it's something that is very important, both primary care and prevention, to keep people as independent, as healthy and as independent as possible, can play a huge role in helping long-term care systems keep providing care in the future. Thank you.
Thanks a lot. And I'm going to Mr. Stacy Yokemernos to ask if we reduce this amount of expenditure on long-term care services for increasing instead the prevention and promotion, perhaps we can avoid to have such a high level of informal careers.
Yes, absolutely, completely agree. As a matter of fact, before joining Eurocarers, I was actually active in the public health sector, so I'm a strong supporter of health promotion, disease prevention, and I do believe that by investing more in public health, we could certainly prevent some of the negative health impacts of aging. Having said that, obviously, we also have to recognize that at some point in our life, we will be dependent. So obviously, health promotion, disease prevention is only one tool in a huge toolbox. And then maybe to conclude, let me say that maybe to build on what my former colleague Caroline Costong said earlier, when it comes to informal care, to some extent, we could even argue that informal care is a social determinant of negative health for carers at this stage. So we could also approach informal care through that, lens and say it is unacceptable that as a result of caregiving, which is rooted in solidarity, people would experience negative health outcomes. So this also should be addressed.
And it is a way to address this matter.
Yes.
We move the money from one side to the other side of the balance.
Absolutely.
Budget. Thanks. Mrs. Todorowska, if she wants to add something in this field for prevention and promotion, since you are a doctor, your main duties or career.
Yes, and you asked me at the beginning, where is the connection between my medical doctor study and economic? Everything costs money, and we have to be very careful how we or manage our own life, and that's why health promotion is very important, not only for our well-being as a human being, but also from financial side. It's important to manage at the last third in our life to manage better our financial sources. That's why we have to invest in our health, and then we can expect better life until end of our life. Thank you.
Thanks to you. Last but not least, again, Mrs. Mestreonos.
Okay. I am going to say something which may be it's out of the ballpark in a way. I think that I would like to see the EU and national governments do a lot more on brain research. That some of the worst forms of dependency are to do with the diseases that come through infections or whatever it is, traumas of the brain or misfunctions of the brain, whether it's Parkinson's or Alzheimer's or whatever it is. We need some more coordinated research on that. And I would like to see that done at the European level, because we could do it for vaccines. Okay, vaccines are a bit simpler. I'm not a doctor, but even I can understand that. But brain research is really fundamental to get some cures, and it's going to help a real lot of people in the future too. We're getting older and we get more at risk of these diseases, not less. So, and strokes and so on. So there's a lot of me wants to do that. Some of it, and just to land up on a slightly positive note, people are getting better educated everywhere. Okay, and just that's the reality. There is some evidence that some forms of disabilities decline, some. And I think also the attitude shift with education. We may have a better income, we may have different attitudes, and that goes back to prevention, that maybe we begin to understand our own role. We have a sense of individual responsibility. We begin to develop this as we get older because we are a lot more educated than we used to be. We actually know that. Maybe, I think my grandmother did know it, but not everybody's grandmother did. And I think we just have to say culture shifts occur, and they will occur in many different ways in this area of care for older people and who needs care. So I think it's a positive sort of note and one negative. We would know we're there on brain research yet, I think. So thank you.
Thanks a lot. I think that we finish our panel session, and I will go the floor back to Maciek, that probably is going to finish it for this morning session also. And thanks to all of you for being with us and to accept the invitation of Age Platform Europe. It was a pleasure to be with you this morning, and I hope we can be in contact also in the future. Maciek, the floor is yours.
Thank you very much, Elena. Thank you again for all the speakers, colleagues, friends. I think it was already extremely insightful, the discussion, all the presentations that we had. Now we will have 1 hour break. We will reconnect sharp at 2:15 p.m. and we will continue with a session that will be moderated by our Vice President, José Luis Tejedor. We will look after this more, I would say, technical discussion this morning when we actually approach different aspects in relation to accessibility, affordability, investment, and of course, quality of care. But in the afternoon, we will put all those aspects into this broader perspective of the rights of older persons. We will have very distinguished guests, both from age, outside even Europe, to discuss how actually this the promotion of empowerment through long-term care can be as well supported and mainstreamed into human rights for older persons. So again, thank you very much for being with us this morning, and we reconnect in 1 hour time sharp. Enjoy your lunch. Thank you very much.
Thank you. Bye.
Bye.
Bye-bye.
Thank you.
Sí, con el viejo.
Good afternoon, Director Mozova. Hello.
Good afternoon. Do you hear me well?
He's muted.
Yes, we can hear you well.
Excellent. Thank you very much.
All right, good afternoon. It is 2:15 sharp, so we are reconnecting for the second part of our conference, part 2, Europe and the Human Rights of Older Persons. This part will be moderated by Mr. José Luis Tejedor, Vice President of AGE. Therefore, without any further delay, José Luis, hello, I'm turning to you for this session.
Okay, thank you very much, Maciej. Good afternoon, everybody. I hope that you have enjoyed your lunch and you got a bit of a relax after a very dense session we had this morning. Extremely interesting, but also a little bit tiring, maybe. So let's start this afternoon session that is devoted to something that sometimes we believe that is so obvious that why we are talking about it, that is human rights. And human rights in Europe. We're not talking about a remote area, I don't know where. No, we are talking about Europe, and we are talking about human rights. We are talking about human rights, particularly in relation with us, with the elder. This morning we have been listening all the progress we are making all together regarding care. Care at home, care at nursing homes, that together with an adequate income coming from a sustainable pension system and many other things, well, allow us to have a good end of our lives. And it's true that things work very fine whenever the circumstances are fine, are favorable. But what happened when those circumstances are not so great? That what we are seeing is that the elder are not as protected as, for instance, the younger population. Let me give you an example. couple of examples. What happened during the pandemic? We have seen a number of cases all across Europe of age discrimination at the time of accessing medical care. How old are you? Oof. Next. We are seeing every single day how people 55, 55 plus, not even 55, 50 plus, they get out of the labor market, maybe with 3 children still at home. And they face extremely hard difficulties to re-enter the labor market because they are too old. While governments, in general, obviously, are much more focused on the young people. Of course, it's horrible to have a young fellow without a job. But what happened with the 55 plus person with a large family that is incapable of finding a job just because he's too old? So what we are saying is, yes, we have progress a lot, but still there's a very long way to ensure that every single citizen, regardless of his age, enjoys his human rights. So this afternoon, we are going to devote this session to this very basic principle, human rights. And let's start with Irina Mosova. She's the director of the Commission on Justice and Consumers for Equality and Union Citizenship. Thanks a lot for being here with us today. It's very kind of you. And we are just waiting for whatever you have to tell us. So the floor is yours.
Thank you very much, Jose Luis. Thank you very much to all of you for this very kind invitation to your annual conference. And let me, at the very beginning, to stress that I personally fully subscribe to the theme of this event, which is that Europe that cares is a Europe that empowers. And I'm really delighted to be here with you today to speak about the challenges, but also opportunities of aging and the way, so how we can best respond to them. As you are certainly aware of, so the European Union attaches a great importance to supporting active, but also healthy aging. And why? Because the Europeans are living longer than ever before and are expected to live even longer and longer. And as you are also well aware, this societal and demographic transformation calls for policies, but also legislative responses in many different fields, such as health services or long-term care. And while I have not been able to be with you this morning, I believe that my colleague from DG Employment, Katarina Ivankovic-Knežević, already spoke earlier today about our efforts in this area, and certainly also advanced to you that we are very progressing well with the care package, because has 2 legs, so one on the preschool care and education and one on the long-term care. And we believe that under the Czech Presidency leadership, so this proposal will be adopted by the upcoming EPSCO Council in December. Now, but to begin with, let me first mention our common efforts in building together the Union of Equality. Let me recall the words of our President, Ursula von der Leyen, the President of the European Commission, which says in her political guidance, and let me quote from her, "A prosperous and social Europe depends on us all. We need equality for all and equality in all its senses." And you know also very well that for the first time ever, under the mandate of this President Ursula von der Leyen, so we have the first ever Commissioner for Equality to address the current challenges effectively. Because we need not only to have a portfolio on equality, we need to mainstream equality in all the policy fields that the Commission is responsible for, because the Commission really needs to address everyone's needs in its policies and proposals. Now, for example, so while discussing green or digital transitions, which are, as you know, the big priorities of this college, we aim to take into account the most vulnerable in all their diversity. And we should address specific needs of our elderly citizens so they can really benefit from these policies and not to feel like being left behind with their concerns. And we know that there are very many, including the recent COVID-19 pandemic, Russian aggression on Ukraine, on the subsequent energy crisis. And there are many question marks, and José Luis just mentioned some of them, so linked to the COVID-19 pandemic and healthcare during this period of time, or eventually the perspectives of the elderly people in the employment market. Now, as a Commission, we are really working towards the integrating of the aspects related to demography and equality, including as regards the age discrimination in all relevant European Union policies, but also in the legislation, and last but not least, because it's very important, into the funding programs. And for example, this December, again, the new creature, which is the Equality Task Force of the European Commission, which is precisely responsible for the mainstreaming of equality into all the policies, is organizing internal event. I think it is for the second time already, which is designed to all services, and it's focused on age equality mainstreaming. And in this event, it is also, I'm very, very happy that Age Platform will make a contribution in order that everybody which is dealing with the policies is aware of the needs of the elderly people and is aware of the possible age discriminations and also the ways how to avoid them when adopting new legislation and new policy programs, new strategies, or eventually new programs on funding. Let me now briefly mention another very important aspect to keep in mind, and this is the intersectionality in this area. Because this is the overarching principle that we respect in all our equality strategies. And you know that under this mandate, so we have adopted gender equality strategy, we have adopted the strategy on LGBTIQ people, we have adopted a new strategy framework on Roma inclusion and participation, anti-racism action plan, we have adopted the anti-Semitism strategy. And in all these strategies that I'm speaking about, in the remit of DG Justice, and most of them, so they are also in my dossier that I'm responsible for. So in all these strategies, this key principle of intersectionality, of looking at the possible even increased discrimination, where of course the age and the elderly can be one of these specific aggravating aspects, should be looked into in order to really be effectively addressing their needs. Because this is the key. We must be aware that discrimination is often multidimensional, and thus we have to start from the premise that only this intersectional approach can pave the way to sustainable and really respectful changes in the society. And therefore, mainstreaming on one hand, but the intersectionality on the other one, so the key for developing effective policies for all. They are instrumental to building a real union of equality where no one is left behind. Unfortunately, despite the existing legislation and obligations at the state level and the national level, but also at the European and the multilateral level, discrimination is still a reality for both young and old people today. And let me underline the importance, the real importance of non-discrimination in the aging area. We should take a right-based approach here, and both youth and older must be viewed at the first place as the right holders. And we must abandon our biases and stereotypes and work effectively against them. And you know very well that the current EU law protects all the persons against discrimination in the area of employment. The Employment Equality Directive prohibits discrimination on grounds of religion or belief, disability, age, and sexual orientation. But once again, This is only the field of the employment, where all the grounds as listed under the Article 19 of the treaty is really embedded. And this is for the time being our key achievement to fight against ageism. But at the same time, this is not the end, because the European Union law does not extend protection from age discrimination outside of the field of employment, sadly. And to fill this existing gap of protection from discrimination in European Union law, Commission has proposed already 2008 so-called Equal Treatment Directive, or horizontal directive, should you wish. And this legislation is to ensure equal treatment between persons, irrespective of religion or belief, disability, age, or sexual orientation outside of the labor market. And this proposal prohibits discrimination in social protection, education, and access to and supply of goods and services which are available to the public. And this Equal Treatment Directive would fill the gap in European Union equality law by affording to the above discrimination grounds as listed a similar, if not equal, level of protection as already exists for the race and gender under European Union law. And you know that the Commission is acting without really any pause, and with a lot of determination and energy to find the ways how to unblock negotiations of this horizontal Equal Treatment Directive. You probably will reply me that these negotiations, they've been in the deadlock for more than 12 years in the Council. But however, this approval of this directive would be a firm step towards the construction of the Union of Equality. And again, as said, we are really addressing it with lots of determination and enthusiasm. And for your question about the 12 years, of course, we encourage the Council to move forward with this proposal. And as an example, yes, we can see that even long-standing stalemates of the proposal can be unblocked. And just recently, an agreement has been reached on the proposal of women on boards after 10 years. After 10 years, we finally been able to unblock it. So I personally believe, and my colleagues are effectively working to unblock this directive as well, because we believe that it is possible and it would be an important achievement for this mandate of von der Leyen Commission. Now, to conclude, let me quote again the Commission and Vice President Schulze when she presented the Green Paper on aging. She said, "The fact that we are living longer, healthier lives than the generations before shows the success and strength of our social market economy, but it also presents new challenges and offers opportunities which we need to consider." And precisely this non-discrimination angle of aging should not be put on the sidelines, but on the contrary, it is the principle that should be guiding us. And I'm pleased to see that you are actively taking up on this challenge and putting efforts to address this important issue for aging population, be it in the field of social systems and health systems, or long-term care, or non-discrimination, or the human rights, as this is the focus of this panel. I would like to highlight the importance and appreciation of the valuable work done by the civil society in this area, but also the activities by the United Nations Economic Commission for Europe. So thank you very much for your efforts and contributions. And I wishing you inspiring discussion in the upcoming panel. And I look forward as well to get your inputs and suggestions precisely on addressing the challenge, on guaranteeing the rights of all generations in the context of economic upheaval and demographic change. Thank you very much for your attention and for your work.
Thank you very much, Irena, for such inspiring words. Very much appreciated. Particularly, I have enjoyed very much to listen from you the effort that the Commission is making fighting age discrimination in all different aspects. Access in education, as mentioned that, medical care, access to the labor market, etc., you name it. It is also true that because of the structure of the Commission, the split of responsibilities between the Commission and member states, well, the situation is a bit complex, I would say. And that's why we believe that a convention to protect the human rights of the people, as it was signed in the past for the children or for the people with disability, it will be a perfect complement in such a way that on one side we could have the directives from the Commission, on the other side we have the convention from the UN, and altogether it will create a framework that will make this fight against discrimination much easier. So again, I don't want to take more of your time. Thank you very much for being here with us today, and I hope that you will keep this enthusiasm in fighting for our rights. Thank you so much.
Thank you very much for giving me this opportunity. And as I said, so I will be very much wishing to learn from your discussion, from your important inputs. You mentioned one avenue of the possible international convention. You also mentioned the specific European architecture with the institutions and the member states with their prerogatives. So there are many ways where we can go and walk together. But the most important is our goal, to achieve the equality, to fight against the non-discrimination, and to achieve the Europe which is in the service of everybody without any distinction. Thank you.
Exactly. Thank you so much. Well, let's keep on going. Let's open the next panel. Sorry. It is composed of 3 speakers that is going to talk to us about what we are saying, human rights, and what we can do to ensure that we all, not just the European, but all elder people can enjoy their rights. The first speaker is Amal Abu Rafe, something similar, I hope. He's the chief of the Program on Aging Section, United Nations Division for Economic and Social Affairs. This division has a key role in preparing the discussion on human rights of older persons in the United Nations Open-Ended Working Group on Aging, together with the United Nations Officer for the High Commissioners for the Human Rights. So Amal, thank you very much for being here with us today. The floor is yours.
Thank you so much, José Luis. And if the interpreters will excuse me, I'll go off script for a moment just to say that much of Irina's words resonated with me, particularly guaranteeing the rights for all generations. I say this because yesterday I was in a think tank within the United Nations discussing intergenerational equity and duties for future generations. And much of the statements made by the UN system in that think tank were that youth are front and center in these discussions. And I asked, because one of the things that I do not like is telling half the story, that if we're going to say youth are front and center, then we should complete the sentence to say, within a context of intergenerational equity, that means that older persons are in the back and sidelines. So this is the essence of the conversation that we're having. So a good place to start discussing the rights of older persons is the very beginning, which is the Universal Declaration of Human Rights. Here, it's important to recall the original sin, where age is missing from Article 2 of the Declaration. So it should come as no surprise that the current international framework provides fragmented and inconsistent coverage of the rights of older persons. 12 years ago, the General Assembly established a working group. It's open-ended in nature to identify possible gaps in the existing framework and how best to address these gaps. 2 years into its establishment, the General Assembly further clarified that mandate by establishing a reporting mechanism that requests this working group to present to the General Assembly a proposal that contains the main elements that should be included in an international legal instrument, which has not happened to date. For over a decade, the working group examined existing laws and procedures with a view to ascertaining whether they provide adequate protection against violations of human rights in old age or on the grounds of old age. Various focus areas were covered, analyzed, reanalyzed, conference room papers were issued, reports were drafted, and hundreds of statements were delivered. But then something happened. Something decisive happened. Earlier this year, the United Nations Human Rights Chief presented a report to the Human Rights Council. In that report, it was made clear that upon undertaking an in-depth review of the nature, extent, and quality of the references to age and older persons in the International Human Rights Instruments, as well as an in-depth review of evolving practice in addressing the human rights of older persons by international instruments, including treaty bodies and special procedures, the UN human rights experts found that the protection afforded under the current framework and standards is either significantly deficient or too general to provide adequate and specific guidance to governments, policymakers, and advocacy groups about what actions are necessary to ensure the realization of the specific human rights for older persons. To us, this means that arguments that the existing whole range of internationally recognized human rights standards and principles also cover and protect older persons without discrimination are not supported by recent findings. On the other hand, arguments that protection gaps are mainly due to a lack of information, lack of awareness, lack of political will, inadequate policies, lack of resource allocation, and private sector engagement. In our view, these are exactly what supports the need for an international legal instrument. It is a basic principle that a state party to an international treaty must ensure that its own domestic law and practice are consistent with what is required by the treaty. So this will urge governments to act boldly and to inject political will that regenerates commitments, leverage policy and legislative change, optimize resources, and maximize deliverables for older persons. Even arguments that many protection gaps and measures to mend them are already being considered under the umbrella of the Madrid International Plan of Action. And I wish to make clear, as the custodian of that plan of action in the UN, that MIPA, while it remains forward-looking at age 20, it offers a solid foundation to bring about far-reaching social, economic, and political changes. However, its successful implementation is first and foremost the responsibility of governments. From what we've seen from the fourth review and appraisal regional outcomes to date, is that there is a persistence of the same challenges over 20 years of implementing this plan of action, which constitutes, in our view, a failure of government business as usual. An international legal instrument would support the implementation of MIPA. In fact, we've seen from the experience of the Latin American and the Caribbean region that in the past years, there's been evidence that there's no contradiction between the plan of action, its regional follow-up, and the creation of a new regional binding instrument. For those who argue that their states and regions are doing so well for their older citizens that they are beyond the need of MIPA and they are beyond the need of a convention, I say this. At its essence, global aging is an inequality issue. Our data shows that by 2050, the gap between the country with the highest life expectancy and the country with the lowest life expectancy at birth is around 32 years. Over 3 decades missed if you were born in a country with the lowest life expectancy. If that does not point to inequality, I'm not sure what is. It is one thing to say that all human beings are born free and equal in dignity and rights. And at the UN, we always look to the EU delegation in the room to reiterate that message when human rights are under attack at intergovernmental processes at the global level. But it is entirely a different thing to move from that statement, from theory to action for older persons around the world. But we all must play a role. Against the background of a devastating pandemic, which directly or indirectly cost the lives of over 12 million older persons within 24 months, with more than half in lower middle income countries, the United Nations is calling for the explicit recognition of the human rights of older persons in the form of an international legal instrument that would place these rights at the forefront and act as a catalyst of action. So what's next? Earlier this year, an informal cross-regional core group was set up by delegations in New York to prepare a draft decision that would be submitted at the 13th session of the working group in April next year. This draft decision will request the establishment of an intersessional working group to meet between 2023 and 2024 to prepare a draft text determining the main gaps in the international framework on the rights for older persons. And we look forward to EU's active engagement in this process. Thank you.
Thank you very much, Amal, for the sorry. Such inspiring words. There's a couple of things that I took note. I really like your concept of saying that the Human Rights Declaration was born with an original sin, which is true, And unfortunately, we are living with that sin since then. Now, obviously, the million-dollar question is, how do we get off this original sin? And it's clear that many organizations all around the world, we are trying to resolve this issue and to try to get rid of this original sin. You are a good Catholic, you can think about the confession, but that is not a concept that we can apply here. Because it is true that you mentioned the pandemic, you mentioned the life expectancy, depending very much of where you are. You have, the expectation of a certain life or another, or just no life, so which is even worse. Thanks again for your presence here. Later on during the Q&A, we will go back to you. Our next speaker is my good friend, Heidrun Molenkov, old colleague from the ESCO, Executive Committee at Age, and one of the persons that has inspired me from the very beginning. I joined Age whenever I retired. I was not, was coming from the private industry, so I was not very much in touch with these sort of activities. Mainly, I didn't pay much attention to the problems of the elder because, well, I was considered myself as not that old until I retired. And then I started to realize that things were not as brilliant as it was supposed to be. And really, Heidrun taught me a lot of things. I really learned a lot of things from you. She, among many other things, she's the NGO representative to the Standing Work Group on Aging at the United Nations Economic Commission for Europe, UNECE. She has played a key role in raising the voice of older persons in this year's conference, updating the UNECE Committee under the Madrid International Plan of Action on Aging, MIPA, at Rome, and the Joint Declaration of Civil Society and Research accompanying these commitments. Heidrun, thank you very much for being here with us today, and the floor is yours.
Thank you very much, José Luis. I'm very grateful that I have the opportunity to speak at this conference on the important issue of the global dimension of the human rights of older people. Amal, thank you for your excellent contribution. I can follow on it. Thank you. So maybe you ask why this issue is so important to us here in Europe. Current events in many parts of the world show us that we are all feeling their effects equally, even if they seem to be happening far away. Older persons are particularly affected by this, whether it's the devastating wars in Ukraine, in Syria, in Yemen, or anywhere in the world, drugs and violence in Venezuela, or global climate change and natural disasters. The effects of the COVID pandemic, the increasingly rapid digitalization, or energy and water shortages, older persons' needs, their hardships, their rights are almost always neglected or completely overlooked. And in most cases, measures are taken determined over their heads. We therefore urgently need measures that apply worldwide to safeguard the rights of older persons. The measures to which 44 European governments committed themselves at the ministerial conference in June this year as part of the fourth review of the Madrid International Plan of Action on Aging, MIPA, represent an important step in this direction. The MIPA is originally based on the human rights of older people. And this year's so-called ministerial declaration often refers to these rights. As an example, I quote paragraph 7. We stress the need to ensure the full enjoyment of human rights by older persons. End of quote. This is an important step forward compared to previous declarations. The MIPA commitments provide a good basis and guidelines for initiating political processes at the national levels. MIPA offers a solid foundation, as Amal just said, but there is a persistence of the same challenges over the 20 years of implementation of MIPA. This is the reason why the Joint Forum of Civil Society and Scientific Research expressly welcomed the human rights-based approach, albeit with the caveat that the agreements are still not binding. In a joint declaration, non-governmental organizations and the scientific community are therefore calling for greater legal binding force to reinforce MIPA's policy goals. The next step on this path will be taken in a few days at the 15th meeting of the Standing Working Group on Aging in Geneva. Based on the ministerial declaration, the work program for the next 5 years will be discussed and adopted there. As civil organizations, we will, of course, emphasize our demands. I just mention a few of our demands. For instance, enhance awareness of ageism, sexism, racism, and all other forms of discrimination and intersectionality. Analyze the increasing prevalence of emerging technologies and the impact of digitalization on individuals, but also on society as a whole. Avoid social inclusion and digital divides. Ensure participation of older persons when deciding on their position and autonomy versus forms of protection and care, including in cases of emergencies. recognize the importance of all types of sentimental relationships and sexualities in older age for emotional, spiritual, and physical well-being. Address the various challenges related to migration and aging, and recognize the specific needs of aging in a foreign land, of refugees, of migrant carers, or of older persons left behind. Understand how different emerging societal phenomena, or as Liz Mesteneos mentioned this morning, cultural changes, how they change the conditions and perceptions of age. For instance, the growing share of persons living alone and without close siblings. The experience of living into very old age with increasing risks of impairments. Are we prepared to this? The impact of globalization or the coexistence of mixed religious and ethnic communities. All this is changing our social, physical, intellectual environment. It remains exciting to see to what extent our demands will be considered in the next working program and what steps will follow. It is equally exciting to see how the work of the United Nations Open-Ended Working Group on Aging will continue. For 12 years now, 4 days a year have been held in New York to discuss the extent to which gaps exist in international legislation regarding the rights of older people and how best to close them. Based on the contributions from member states, non-governmental organizations, and national human rights organizations, 2 key topics have been discussed in detail at each meeting since 2017, and proposals for specific legal protection mechanisms have been made. However, no agreement has yet been reached on these elements, although both the thematic reports and the working paper prepared by the Office of the High Commissioner for Human Rights have highlighted ample evidence of gaps in the existing international human rights framework. A convention on the rights of older persons, as called for by civil society, human rights organizations, and some countries, could significantly substantiate and strengthen the MIPA's political efforts. At the same time, the global challenges mentioned at the beginning. Let me just remind you of the terrible war against Ukraine, about which we will hear more in a moment. These threatening risks of violations of older persons and their rights show the utmost urgency to finally reach a globally valid, binding agreement on the protection of older people's rights. There is hope for a further step regarding the informal cross-regional core group already mentioned by Amal. Until now, the core group has met twice. The participation of NGOs and National Human Rights Institute is planned, but has not yet taken place. As civil society organizations of and for older people, we hope that the timetable introduced with the group's proposal will lead to concrete results by 2024. Because in view of the burning problems worldwide, we urgently need protective measures that apply and work globally. In the case of protecting older people and their rights, this can only be an internationally binding instrument, such as a UN Convention on the Rights of Older People. Thank you.
Thank you so much. Sorry. Thank you so much, Heru. I mean, I cannot agree more with what you are saying. I really face strong difficulties to understand how governments that are supposed to go against discrimination and these sort of things, they are fully committed in theory to fight against ageism. They play this role of ageist. Hey, in the same way, you signed the convention to protect the rights of the children or the people with disabilities. What's wrong with us? Why you are not, what you are so close, to accept that in the same way that the children had their peculiarities, so the people with disabilities, they have the peculiarities. We, the elder, we have our own peculiarities. But in any case, what is true is that by pushing, by being present in every single forum, we will make it. And with people like you, I'm sure that we will. Thanks again for being here with us today. Now let's keep on going. Let's welcome our next speaker. Our next speaker is Alexandre Sidorenko. He's a senior advisor at the European Centre for Social Welfare, Policy and Research, where he provides advisory services to governments on policies on aging. Also, in the framework of the UN Economic Commission for Europe, his research interests focus on the development of evidence-based policy on demographic change and aging. He's Ukrainian and has led an assessment of the situation of older Ukrainians in the beginning of the current war, and committed to raising awareness of the situation. Alexander, thank you very much for being here with us today. The floor is yours.
Thank you, Jose Miguel. Good morning and good afternoon to everyone who decided to make this conference and this particular session a part of their day. I will start with a brief reference to terminology. When talking about my country, Ukraine, these days, we use interchangeably such terms as conflict, invasion, war. Russians until recently used Ethiopian language, special military operation. For Ukrainians as citizens, for Ukraine as a state, this is an existential war, a war for the survival of people and the nation. The pretext for the invasion fabricated by the Russian leadership and scattered around the world by the Russian propaganda machine was the, quote, denazification and demilitarization of Ukraine, unquote. In fact, the content and purpose of the special military operation is the Ukrainization of Ukraine. We talk today about the human rights, including the rights to be alive. The very special Russian operation has all the signs of genocide. Atrocities in Bucha, Irpin, Izum, and other small and big cities of my countries. And our first reports are coming about the torture chambers discovered in the recently liberated Kherson region. Destruction of vital infrastructure, power plants, pipelines, hospitals, schools, continuing attacks on energy infrastructure, leading to a major energy crisis in the country, with repeated cuts and power outages all over the country, just in these minutes, today. Forcible transferring Ukrainian children to Russia, away from their country and their relatives. The Russian invasion has created a humanitarian crisis not since the Second World War, or the Second World War II. According to the Regional Bureau for Europe of the United Nations Refugee Agency, UNHCR, I quote, since the onset of the Russian Federation's invasion of Ukraine, 1/3 of Ukrainians have been forced from their homes. This is the largest human displacement crisis in the world today. Over 7 million people remain displaced in Ukraine by the war, and almost 16 million people are estimated to urgently require humanitarian assistance and protection. As of end June, UNHCR estimated that there were at least 5.5 million refugees from Ukraine across Europe. The oldest humanitarian crisis in the world, these descriptions coined by H Platform Europe, properly reflects the plight of all the Ukrainians. Unfortunately, the scarcity of age disaggregated data does not allow for precise assessment of all the people affected by the invasion. With total population of 40 million, Ukraine has over 10 million people aged 60 and above, roughly a quarter of the total population of the country. Despite of making up a quarter of the country's population, millions of older Ukrainians caught up in the war are being overlooked in the humanitarian assistance measures. All the people remaining in Ukraine need help to survive. The needs of refugees are somewhat different, of course, at least they're in their relative safety. Yet they do also need help in finding accommodation, receiving medical care, acquiring language skills, finding the job. Again, data on age profile of refugees remains fragmented and mostly unreliable. According to the Kiel Institute for the World Economy, the European Union government institutions are among the largest bilateral supporter of Ukraine, next only to the United States. In percent of donor GDP, Eastern European countries stand out as particularly generous. The European Commission informs that, quote, since the Russian aggression started, the European Union, its member states, and its financial institutions have mobilized over 19 billion euros to support Ukraine's overall economic, social, and financial resilience. Humanitarian aid amounted to 523 million euros. On October 19, 2022, the European Union announced a new emergency shelter and winterized facilities program for Ukraine, as well as an additional 175 million euros in humanitarian assistance to support those most in need in Ukraine and neighboring Moldova. Financial allocations are crucial, of course. Delivery of support is vital, and under the conditions of ongoing war, most challenging and often dangerous. Numerous local NGOs are taking care of for local older people and displaced older people, providing the essentials, food, dress, and shelter. At the national level, the NGO Турбота про літніх в Україні, Care for Older People in Ukraine, is the main actor in humanitarian assistance. Among the international NGOs working in the field of aging, Help Age International is the most active in Ukraine. Age Platform Europe is partner of Help Age International. This year's theme for the International Day of Older Persons was Resilience of Older Persons in a Changing World. During these 9 months of the war, the resilience of Ukrainians of all ages has been proven. The determined Ukrainian spirit endures. However, the winter is ahead. They expect snowfalls, by the way, this week in the central part of Ukraine. And Russia continues its efforts to destroy the country and its people. This morning, at the opening of the conference, Danish journalist Anne Poitman spoke about the importance of caring for both the body and the soul of older persons. She told a beautiful and touching story about a bedridden older woman from a nursing home who wanted to see the sky from her bed. And her wish was had, and she was able to see the sky and flying clouds during the last 3 months of her life. You cannot see the sky from the bomb shelters. Thank you.
Thank you very much, Alexander. Definitely, it's difficult to understand how it's possible that on the second decade of the 21st century, we are looking at this sort of these unbelievable events. It's just impossible to conceive that this thing is happening. Obviously, you know that you got all our solidarity, that we are with you, and that whatever is in our hand to help you, obviously we'll do it. It's a pity that this sort of one-man show, because this is, I'm sure that it's a one-man show, is provoking this disaster. Again, our sympathy and solidarity with you and the Ukrainian people. Then, having said that, we have still a few minutes for a Q&A. On one side, well, I can address a question to each one of you, but I would like also to encourage our participants to use the text box to include whatever question they would like to ask to any of you. My first question it would be, because we are in Europe, let's talk about a little bit about Europe. Amal, you will come later on. Hayden, in your opinion, how can the EU, the European Union, strengthen the rights of the other people? We know that there are certain limitations because of the structure that we have today in Europe, but what else can we do, the NGOs? What else the Commission can do in order to ensure the enjoyment of our rights?
Well, fortunately, we have already rich reference in European treaties, agreements, directives on human rights of older persons. Irina Mozova mentioned as well just a few minutes ago how important equality is in Europe. So the revised European Social Charter was the first ever provision worldwide enshrining the human rights of the elderly to social protection, or the 2014 Committee of Ministers of the Council of Europe adopted a recommendation on the promotion of the human rights of older persons. I can add more and more of examples. So what I think is important is to put more pressure on national governments to either ratify, adopt, and most of all, implement these rights. Most of them have committed to do it, but the reality looks very different. But I think this is the most important thing. Another step would be to make the process of agreeing on common statements, for instance, at the open-ended working group, would become more apparent. And we would be able to discuss with country representatives or governments why they are supporting a convention or why they are against. So it would be easier and more transparent how the statements of the European Commission in New York, how or on what they are founded. So just a few possibilities.
Yeah, thank you so much. Yeah, it's very true what you are saying. Let's open a little bit the scope of our discussion. Alexander, in your opinion, what are the main gaps and limitations of the human rights current norms and obligations? Why we are suffering what we are suffering? What are these gaps?
Thank you, Jose Luis. The same question has already been answered practically by my fellow panelists. It is because we don't have an established framework at the international level against which we can possibly compare the national legislations and check the national situation with regard to the human rights of older persons. Since 1948, as Amal has mentioned already, we've been talking about human rights of older persons, forgetting about them for 20 years, until 1968, when the government of Malta brought it back to the attention of the United Nations, and then slowly moving, preaching mostly to the converted. So the time is really to start persuading those who are responsible for taking decisions that it's not about just attending to the missing issue. It's about putting people together in the aging society and making the perspective of fulfilling individual development until the very end of our life interesting, useful, and rewarding. Back to you.
Thanks a lot. Amal, we are talking about a convention. Maybe for the people that are not so familiar with this concept and what a convention can bring to all of us, I would like to ask you a very simple question. In your opinion, what would be the impact of a convention of the rights of elder people at local, national, European, obviously, international levels? In which way this the signature of this paper will change a little bit our situation?
Yeah, thank you. That's an important question that I keep asking my colleagues who are human rights experts in the UN about as well. And we know already from existing international legal instruments that when one instrument is implemented, it marks a significant paradigm shift in how we combat age-based discrimination, whether it's in institutions, whether it's in attitudes, whether it's in practice, and that we know continue to be rampant and were exposed by the pandemic. And instruments will enhance the ability to unpack the complexities and the changing nature of discrimination, because it's not static, and how it intersects with other forms of inequality and across the life course. People often are very myopic in their view, thinking that this is just for older persons. It's in fact for youth as well, because they are the future generations of older persons. So, and this year, I have to say, the fourth review and appraisal of MIPA, we've heard from member states from all regions making reference to the need for a legally binding instrument. You could see that the conversation has become ripe. And like Alexandra was saying, we were often preaching to the usual suspects, but I think now's the time to really, you know, like my son who has a driver's permit says, which scares me, put the pedal to the metal and press on that gas really hard. It's uphill still, but this is the time to keep pushing forward with that, to see that it really would benefit a society for all ages. Thank you.
Thank you, Mal. We have here in the text box a good point from Anthony Di Giovanni, because I think that is a very basic but very good question. How and why are all the citizens a discrete and distinct group for whom a special legal thought and treatment, such a convention, is justified? It's a good question. Are we different than than you, Amal. That is, you are a young lady.
Yeah, thank you. That's thanks to cosmetics, José Luis. Yes, they are different. And we can have that intellectual, conceptual conversation of what defines old age. In fact, the custodians of national statistics around the world have established a voluntary group called Titchfield City Group. And in 2024, they're going to submit a conceptual framework to the Statistical Commission at the UN, talking about, what older age is. We can have that conversation. But the fact is that, there are normative gaps in the protections. And I'll give you an example, and I'm going to read it carefully because I'm not a human rights expert. But there's an example that I want to give in the advanced exercise of legal capacity. Okay. I recall that in some of the inputs into the open-ended working group, one of them said that some EU countries do not allow advanced directives and lasting powers of attorney. Okay. This violates older persons' right to autonomy, which is right to have control over their life and their own decisions when it comes to end of life. This is something specific when you reach your later stages of life, and chronological age should never be a reason to discriminate against older persons from receiving medical interventions, palliative care, or other support at the end of life. And these are not defined clearly in the existing instruments. And older people should have the ability to express what are their preferences towards the later stages of life with free, informed, genuine, and irrevocable consent that the government is obligated to uphold. That's just one example of many. We have tons beyond, and a very simple one that I would mention here as well is elder abuse. With all the work that's done on preventing and eliminating violence against women, for example, data collection stops at age 49. So if you're menopausal, no one really cares if you're subjected to abuse beyond age 50 and above. This is why everything is anchored in age discrimination. There's a productivity bias that's hidden there that no one wants to talk about. And I think if 12.3 million children, God forbid, had died within 24 months, or 12.3 million youth had died within 24 months from the pandemic, the world would have reacted differently. So yes, there are differences in the legally speaking, morally speaking, and even evidence-based with data. Thank you.
Yes, I cannot agree more with what you just said. I mean, if a number of a million of small children pass away, it will be a disaster. Everybody will be shaken, saying, what's going on? If the same number of people passing away is, let's say, 65 or 70 plus, well, yeah. Now, it's true that at the end of the day, you get the conclusion that the problem is that we don't pass away fast enough. But, my next question is, let's go back to Europe. In our opinion, I mean, NGOs' opinion, Hayden, what do you think that, what could be the role that the European Union could play in advancing the rights of older people, and in particular, in the international context of MIPA or the open-ended working group? What else, in your opinion, the EU could do?
Well, I said already that the European Union could push the governments, the national governments, to implement what they agreed to do. This is one aspect. Another aspect is they could support a convention, or at least the discussion about a convention. Because we see at each meeting, at each session of the working group, the European representative reading a well-formulated paper, but we don't know who is really behind that paper, who is behind the decisions, why it is formulated in that way. And therefore, it would be necessary to have something like a focal point for the human rights of older persons. A focal point we would be able to address and ask and brief, for instance, with what we see important. And another step would be, as we do, for instance, in Germany, with the National Human Rights Institute, we do a briefing after the sessions of the open-ended working group. We report on what has been said, what has been agreed on, what has not been agreed, and what might be the next steps. So why doesn't the European Commission organize such a debriefing after the meetings, after the sessions in New York? So there are several opportunities. And of course, it would be possible to create something like a platform, a virtual platform, or a platform where people from different backgrounds can meet physically to talk about their views, their experiences, their needs and their rights, and to listen and to create mutual understanding. And that way, maybe progress in the understanding why we need a convention. So these are my suggestions.
Yep, very interesting thoughts. There's another comment on my good friend Claude Barret at the text box that I would like Alexander to address, because it's a very straightforward question. He says, we can produce additional legislation, but how do we implement this new legislation? How do we have to act to improve the implementation? Because what we are seeing is that, yes, there are many laws, many legislation, many initiatives, blah, blah, you name it. But at the end of the day, nothing happens. So what do you think, Alexander?
Jose Luis, I think it's sort of the general question how the governments are working. It's not only the area of aging where the beautiful legislations are developed, adopted, and then these volumes are dusted somewhere in the side room of the ministries. Aging is a good example. I had an opportunity to sort of follow the international developments in this area since late 80s. And at that time, that was sort of the side issue on the agenda of many governments. Even in Europe, although Europe led to much extent the international activities in the field of aging. The first World Assembly on Aging took place in Vienna, Austria. The second was also in Europe, and that's the Madrid Assembly in 2002. So the question is, what can we do to make government more accountable? One of the approaches is to have some sort of a watchdog activities which are very well organized, but how you can possibly make this watchdog activities by bloggers who are covering these issues less self-centered. That's the big issue, the big question. Another thing is, of course, to have a structure within the government or legislature which would involve all the persons themselves. And there are quite a few very good models, including in Europe, where this has been established. I'm referring to Austria, in the first instance, the country where I live now, there's a very interesting model in Austria, the Federal Senior Citizen Advisory Council, which is linked to the legislation, to the parliament. It has the power of reviewing the new legislation and making the proposals to the new legislations. Of course, it's not a veto power. I would say, unfortunately, it is not. But still, it's a powerful office which contributes significantly to the development of legislation related to older persons. But most importantly, of course, to have something very similar at the local level, where actually the services are delivered. And in this context, I would certainly refer to Denmark, which has established, I would say, a vertical of involvement of older persons at practically each level of implementation of national policy on aging, from the parliament to the local institutions for older persons. So they're useful models, helpful models, interesting models, but I don't think they have been spread all over the world. And even within the Europe, there are significant gaps. Over, Jose.
Thanks a lot. I was many times I have wondered how their sectors of our society have been, in principle, quite active and quite successful in fighting for their rights. I'm thinking about LGBTI people. I'm talking about racism. Each time that there is, disgraceful success, and there is a big noise, governments are paying quite a lot of attention. On the other side, for instance, here in Europe, well, LGBTI people have been well protected. It is true that they have been very well organized, but they have achieved in a relatively short period of time a number of achievements, being a rather small portion of the society, maybe less than 1%. Depending on the country, here in Europe, we are around 20% of the population. If we were all together, we will win all elections by large majority. But we are still, in this process of saying, hey, what happened with us? In your opinion, Amal, is there something that we, the elder and the elder NGOs, are doing not good enough? Are we maybe too nice? We are not noisemakers? Why some sectors of the society are, moving fast and achieving goals, in very short time, and we that we are 20% of the population, we are still, going around.
Yeah, that's a very good question. The issue that you're fighting for, that you're asking for, is an issue that scares people. It's about people facing, worries about what their older age will look like, worried about what, approaching the end of your life will look like. From my experience, dealing even with senior leadership within the United Nations, they're quick to make reference to what their retirement will look like that they're looking forward to, or make reference to their mothers, and how much they love them and they're worried about them if they pass away. At a personal level, people will react, favorably to this issue. But at a policy level, people don't want to deal with it. And in many countries, it's seen as a financial burden. And that's why it's an uphill battle. I think civil society representatives and organizations of older persons have been working very hard, but there comes a point where you also have to work, smart. And team up with these other civil society organizations. At the open-ended working group, I don't see any persons with disabilities participate, although the latest data, which is at least 6-7 years old, says that half of persons with disabilities worldwide are older persons. They're not there. I don't see any indigenous elders come and participate. They're very active in the forum. It's a very politically sensitive issue at the United Nations. They're not there. That's the hard sell, and I don't see youth attend. And with this generation of young people, with the gig economy, the startups, the entrepreneurship, their future is going to be much more difficult than that of older persons today. In Europe and in developing countries where many more people are going to age in a much faster pace than Europe had the privilege of taking its time through it, are going to even suffer more. They don't see that. So there's a lot of need to work across these groups, which is very difficult. I know with the civil society that I've been talking to that it's a very difficult conversation to have. And I think that UN leadership should lead that conversation. I started off by saying youth front and central should also, that sentence should be completed with older persons in the back and sideline. So that's why I said it continues to be an uphill battle, but I very much encourage this teaming up with other stakeholders as well, because this is something that will affect them too. I passed it on to Hydra. I see her hand up. Thank you.
Yes, thank you. If I may, I would like to add to this. I think it is the effect of ageism, of the secret message to everybody that it's not good to be old. And that's what older persons or everybody learned during his life, that you shouldn't be old. You should have a long life, yes, of course, but old age is something you should avoid. And I think this is one of the reasons why older persons don't join together as older persons. This is one of the reasons. Another reason is that the differences, the heterogeneity among older persons is huge. You cannot put a 90-year-old clever, high-level man together with a 60-year-old person who has never gone to school, who is impaired in many ways. What do they have in common? And the difficulty, another one is, we discussed sometime before about what is characteristic for old age. And there is a paradox. On the one hand, when I think of myself, I am still the same person. I have not changed much since I was a young girl going to school or working or having children and so on. I have the same or similar, almost the same needs, wishes, interests as I had before. At the same time, you change when you get older. And you are different from young people in many ways and many aspects. So these are the different difficulties when we think about older people calling for their rights. And I hope very much that by the efforts, the publications, the conferences, the meetings we do as NGOs, that this will help older persons to see themselves as rights holders and not as something which, yes, is no longer valid for the community. That's my experience. Thank you.
Yes, ma'am. Yes, Heidrun, absolutely. In few words, we are an asset, not a burden. Well, thank you very much to all of you. It has been extremely useful. I have learned a lot. Definitely, you are a leader of opinion. Your contribution to this conference has been just outstanding. Thanks a lot. Maciej, the floor is yours from now on.
Thank you very much, José Luis. I found extremely enlightening this very last exchange about basically about how we all individually, but also as a society, are perceiving aging again as an individual path, but also as a phenomenon of a society which, thanks to progress, obviously gives this impressive improvement in life expectancy. And at the same time, this is what I take from the last couple of exchanges, we are still struggling to recognize or to approach aging, older life as an additional moment, this prolonged actually chance to live something which is fulfilling, professionally, individually, all of us. So I think we are here getting back to the very basics of our work, of our advocacy, which is about indeed the challenge of taboo around aging, ageism, stereotypes, prejudices about age. It's something that I believe we as older people network, we have to challenge, but it's something which is part, as Heidrun said, I think, of our minds ourselves as people who are actually aging. So this is certainly as well, I would say, an additional lesson and guidance for the discussion on the dignity in the provision on long-term care. The more actually we all understand about this equality, equal chances that we have, even if we get older, to live in dignity, the more we are conscious about it, the more I think we will be as well conscious about the need to fight, to introduce instruments, policies, which will actually make the equality in old age reality. So thank you very much for this last panel. And now I have the pleasure to, we are about to close this conference. We've got ahead of us still two speakers. Now I'm turning yes to our old friend, if I can say so, in the fight for age equality, Milan Brglez, member of the European Parliament. You are with us. Thank you very much for joining us. We know that you were traveling and you made your let's say, your best to be on time with us. I don't know whether you received any feedback from all the different things that was said along this long day of the discussion, but I'm sure that you will, in any case, have some thoughts on your side on how the European Parliament in this legislature, but also in the previous Parliament, will be an actor in this discussion and in the implementation of, as we said, a new alternative vision for long-term care, which empowers, which allows everyone to live, to participate in equality till the very end. So, Milan, the floor is yours.
Thank you very much. Dear Mr. Johansson, dear distinguished representatives of the Commission and the Council Presidency, dear participants of the Age Annual Conference, dear ladies and gentlemen, I feel honored and privileged to participate in your distinguished event in these important, albeit challenging times. As the past social and economic crises are overlapping with the new ones, it is crucial that we have at our disposal political tools which empower the citizens, especially those in need of care and support. If we are to take away something positive from the COVID-19 pandemic and the multi-layered crisis caused by it, it is the reinstated centrality of solidarity and the care as the key principles guiding the work of H, my political priorities, as well as the endeavors of the like-minded colleagues in the European Parliament. What is more, the last crisis established that this sense of urgency to act at the European level in response to our burdened and increasingly deficient care systems, and resulted in the commitment of the Commission President to present the proposal for a European care strategy. As a chair of the Parliament's interest group on solidarity between generations and the co-rapporteur for the report towards common European action on care, I have been following very closely the evolution of Commission proposal. It is not a secret that I, like many stakeholders whom I had the opportunity of meeting before and after the publication of the communication and two proposals for Council recommendations, was somehow disappointed by Commission's vision of care, especially future policies in the area of long-term care. Most of our proposals on long-term care, including the call for the equivalent of Barcelona targets in the area of long-term care and for a framework directive that would set minimum standards on quality care, as well as decent working conditions for both formal and informal carers, did not make into the Commission's documents. Primarily national competences in the field of long-term care and policies for older persons remain the main obstacle, and to a certain extent, a convenient excuse for avoiding recognition of care as a right and for setting minimum European standards for a person-centered integrated quality care. Despite different level of ambition between the position of the Parliament and the deliverables of the Commission, especially the lack of legislative proposals and concrete programs for long-term care, the European Care Strategy represents the only palpable follow-up to the Commission reflections on demographic change and Green Paper of Aging. The most important step forward is that the Commission foresees improved monitoring of progress in the implementation of the recommendation on long-term care as an integral part of the European semester. I remain convinced that the instrument of national coordinator for long-term care, similar to national coordinating body responsible for the implementation of European Child Guarantee, will be conducive to drawing up ambitious national action plans and encouraging upward convergence in social matters across Europe. The European Care Strategy was drawn up before the current economic and social crisis, triggered by Russian aggression on Ukraine, took full swing and deteriorated the accessibility and affordability of care services for the increasing number of people in Europe, especially older persons with low income. In order to keep the care and the fight against ageism high on the agenda, it is essential that the member states adopt the two recommendations as soon as possible and guarantee their vigorous implementation, making full use of the financing and other opportunities that avail themselves at the European level. Recognizing the steps in the right direction made with the European Care Strategy, we should take advantage of this change in the discourse for the existing on comprehensive package of policies and public investment in care, both at the European and at the national level. The latter is essential to facilitate profound reform of the care systems and empower both persons in need of care and support, as well as their carers, especially older women who represent the majority of both aforementioned groups. In her State of the Union speech delivered in Strasbourg in September, President of the Commission renewed her commitment to uphold the principle of solidarity between generations by enshrining it in the European treaties. I warmly welcome this plan of the Commission as an important homage to the principle of solidarity between generations that is at the heart of the European way of life. However, symbolic steps are not enough. We have to use this momentum for building a progressive alliance around the call for a care deal for Europe, which would put the principle of solidarity between generations on the equal footing with the green and digital transition in Europe. As already stated in the Parliament's resolution adopted in July, such care deal should entail legislative proposals, programs and investment at the European level that would enable a transition towards a gender transformative care economy and recognize care as a right and the backbone of our society. Care systems, with their numerous challenges and deficiencies, as well as lack of accessible and affordable quality formal care services, which only aggravate disproportionate pressure on informal carers, especially women, are an ideal ground for tackling ableism, ageism, gender-based and other forms of discrimination that intersect with prejudice and stereotypes associated with receiving care, paternalism, and ideologies of dependency. The magnitude of challenges and tasks ahead of us in improving the access to fundamental rights and social inclusion of all generations, above all older persons, demands a strong partnership between decision makers at the European, national, regional, and local levels, expert and civil society organizations with first-hand experience of working with the persons concerned. I would like to thank Age Europe for all the support in advocating the rights of older persons and the solidarity between generations through policies and measures that empower persons in need of care and support throughout the life's course. I'm certain that this annual conference and discussions with the Commission and Council Presidency on the implementation and follow-up to the recently presented proposals in the area of care will serve as an impetus in identifying new opportunities for joining our forces in empowering all generations of European citizens. Thank you very much for allowing me to be a part of your yearly conference, for your kind attention and for excellent cooperation in the past year. All the best to all of you, and I'm excited to continue working with you towards Europe that cares. Thank you.
Thank you very much, dear Milan. You know that you can count on us, as you said. The strategy on care, its publication, it's only actually a start. So we've got now together allies between civil society, European Parliament, and all the stakeholders who actually join us in our vision for long-term care that empowers. Now we will have more work to do to ensure that there will be implementation both at the European and national level. So now I have my pleasure. I will hand over to Age President Ebbe Johansen. You are with us. Ebbe, you've got the last word to close and summarize our conference. Thank you very much. Go ahead.
Thank you very much. And dear participants, it has really been an enlightening day. I have enjoyed all the speakers, and I would like to thank them all for their contribution. It gives us good base for what we have to do. And I have actually planned to address 4 points. The first of the points is to look at the adoption of the care strategy. And the second one is to promote age equality. The third one, of course, is to implement human rights for all ages. And the fourth one, sadly enough, we still have the question about Ukraine, and we want to discuss what we can do for people fleeing the country and the war. Let me start with the first point on adoption of the care strategy. I think building on the outcome of our 2022 annual conference, each with its members will monitor an implementation of the care strategy, both at national and EU level. In most areas covered by the strategy, the Commission kicks the ball to the member states, who should now agree on indicators, targets, quality criteria, or request specific funding for transforming and developing their long-term care systems. Therefore, we encourage member states to adopt the Commission's proposal for the recommendation on long-term care. We urge them to adopt it as soon as possible under the Czech Presidency, and on this basis, launch ambitious reform to implement the strategy at the national context. This should in turn trigger the transformation of national care system towards more fairness, human rights, and dignity. The second point I want to address is what we talked about regarding the promotion on age equality. And today's conference is part of AGE's broader advocacy to promote age equality. In response to the consultation on the Green Paper on Aging in 2021, we submitted a proposal for EU age equality strategy. We would like to today reiterate our call addressed in 2021 to President Ursula von der Leyen for such a strategy. While we strongly welcome the Commission's proposal for the care strategy, we insist on the need for a comprehensive policy framework on aging, anchored in the human rights throughout the whole life. Such strategy should propose actions to address multiple objectives on aging, challenge age discrimination and age stereotypes, achieve equal participation in society, improve equal access to employment, enforce the right to adequate income, foster access to health and long-term care, improve the mainstreaming of aging across EU policies and initiatives. My third point will be to address the implementation of the human rights for all ages. To promote human rights for all ages, equality at international level, tangible progress is needed in reflection on the UN Convention on the Right of Older Persons. We call on the European Commission and EU member states to actively engage in this UN process and to play a leading role in the global discussion on dignified, healthy, and active aging. In this respect, more synergies are also needed between EU action and the World Health Organization's work under the UN Decade of Healthy Aging. My fourth point and last point is really on the geopolitical current situation of older persons living in Ukraine or fleeing the war to settle in EU, and remains in the scope of age advocacy. Facing enormous difficulties when escaping war zones, lacking money to survive, lacking access to health and care, struggling with the socio-economic integration in their new environment, experiencing abandonment and loneliness, older people staying in Ukraine and those fleeing the country need our financial, logistical, and emotional support. AIDS published last week a new policy brief on the reality of older people in and from Ukraine, with some recommendation to policymakers on the support which is needed immediately and in long term.
let me thank you all for your participation. And I think I would like to say what I learned, focus on particularly was this of really putting the focus on the person rather than the system, and integrating the informal care with the formal care. We have a job to do in making this realization. I want to very much thank our speakers for their contribution, and I look forward for you to work on all what we have learned today. IH wish you all the best. Thank you.
Thank you very much. By this, I have the pleasure to close the conference. Once more, a very warm thank you to all of you, to the speakers, to the participants for your involvement, comments. All this will be obviously duly recorded in our report. And of course, the work starts, or rather is going on. We will build on all the recommendations and lessons from today's discussion. Thank you very much once again. Stay safe and meet all of you very soon. Thank you. Goodbye.